A dying soldier was suffocating on a trauma table while 6 doctors argued over the wrong diagnosis. His oxygen levels were crashing, his lips were turning blue, and every single person in that room with a medical degree was wrong about why. The only one who knew the truth was standing in the corner, hands shaking, wearing scrubs 2 sizes too big, trying not to be noticed. She was 27 years old. She had no attending title, no published research, no political allies in that hospital. What she had was 4 deployments and a battlefield that taught her things no classroom ever could, and in about 90 seconds, that soldier was going to die unless she said something. She said something. Before we go any further, if you're new here, hit that subscribe button right now because this channel is where we tell the stories they don't put in the headlines. The ones about ordinary people carrying extraordinary secrets. Hit the like button if you're already hooked, and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story travels. Now let's get into it. Because what happened inside Harrowfield Medical Center on a Tuesday night in March is the kind of thing people in that hospital still don't talk about out loud. The city of Dunmore, Pennsylvania had the kind of winters that felt personal. The cold didn't just settle in. It pressed against you, found the gaps in your coat, reminded you it was there every time you tried to breathe. It was that kind of night when the ambulance bay doors at Harrowfield Medical Center blew open and the gurney came through fast, wheels screaming against the linoleum, paramedics talking over each other in that clipped, breathless shorthand that meant someone was already close to the edge. Mara Valdez heard the radio call from the supply corridor where she was restocking crash carts. She always heard them first, not because she was positioned well or because anyone bothered to loop her in on incoming trauma, but because she'd trained herself years ago to listen for the specific frequency of panic in a person's voice. The paramedic on that radio had it. She came around the corner just as the gurney cleared the double doors. The patient was a large man, military build, mid-40s, wearing the remnants of civilian clothes that had been partially cut away. His face was the wrong color, not the pale gray of blood loss, not the waxy yellow of liver failure. Something else. Something that made Mara's stomach drop in a way she hadn't felt since a different country, a different uniform, a different version of herself she'd spent 3 years trying to bury. GSW to the left shoulder, secondary blast trauma to the chest wall, one of the paramedics called out. BP's holding at 90/60, oxygen sat dropping. We've been bagging him since the scene. Dr. Clifford Holt was already in motion, moving to the head of the bed with the practiced authority of a man who had been the loudest voice in every room he'd ever entered. He was the chief of trauma surgery at Harrowfield, which meant, in practical terms, that he was the person everyone deferred to and the person least likely to admit when he was wrong. He had the kind of resume that got framed and the kind of personality that made residents cry in storage closets. Tension pneumo, Holt said, not looking up. Get me a needle. Mid-clavicular line, second intercostal space. Mara moved closer without deciding to. It was muscle memory, older than her nursing career, older than Harrowfield, older than Dunmore. She looked at the patient's neck veins. She looked at the rise of his chest. She looked at the color of his fingernails and the way his trachea sat just slightly, just barely, off-center in the wrong direction. Doctor? Her voice came out quieter than she intended. His trachea's deviated right. Holt didn't look at her. Tension, pneumo, deviated trachea, standard presentation. It's deviated toward the injury, she said. That made one of the residents glance up, just for a second. If it were tension pneumo, it would deviate away, Mara said. This is something else. His breath sounds on the right side. I don't recall asking for your input. Holt's voice had that particular edge, the one he used when he wanted a room to understand that a conversation was over. You're here to maintain the IV line and document vitals. Do that. The resident looked back down. The moment closed. Mara stepped back. Her hands were steady. She'd learned that trick a long time ago, keeping her hands steady even when everything else in her body was screaming. She watched Holt prepare the needle for decompression, and she thought about the weight of staying quiet, which she had also learned, and which sat in her chest differently every time. The patient's oxygen hit 78%. The monitor alarm changed pitch. He's dropping, a nurse called. Holt inserted the needle, waited. The hiss of air that would have confirmed tension pneumothorax didn't come. He inserted it again, repositioned, nothing definitive. The sat kept falling. Needle's not resolving it, the resident said, careful, tentative. Should we, It's bilateral, Holt said, and pivoted toward a chest tube setup. Mara was already doing the calculation she hadn't stopped doing since the patient rolled in. Right-sided tracheal deviation toward the injury site. No classic tension presentation despite initial positioning. The blast trauma. The way his right chest wall moved when he strained, or rather the way it didn't move, not quite right. A subtle paradoxical motion that looked like effort but wasn't producing air exchange. And the sound she'd caught in the half-second she'd been close enough. That muffled, distant quality on the left that shouldn't have been there if the problem was on the right. She looked at his neck again. At the veins. At the faint, almost invisible distension that wasn't tracking with what Holt was treating. Pericardial tamponade. Fluid around the heart, compressing it from the outside, strangling it slowly. Not a pneumothorax. Not bilateral. The blast had driven something, shrapnel, bone fragment, something, into the pericardial sac, and blood had been pooling there since the scene, and in about 60 seconds this man's heart was going to stop, because no needle in his chest wall was going to fix that. Doctor. She said it louder this time. Valdez. Holt didn't turn around. If you say one more word in my trauma bay without being addressed, I will have you removed and written up before morning. The sat hit 72. The patient moved. Not much. A slight turn of his head, that specific kind of effortful motion that people make when they are using the last of something. His eyes found the room, and then Mara felt it before she understood it. They found her. Not Holt, not the residents clustered at the supply cart, not the nurse closest to him. Her. He looked at her the way people look at something familiar in an unfamiliar place. His lips moved. She couldn't hear him over the monitors and the noise of the room. She took a step forward without thinking, leaned in, and he said it again, ragged and quiet and absolutely deliberate. Kestrel 9. Doc. The sound went out of the room for Mara, not literally. The alarms kept screaming. Holt kept talking. The resident was saying something about chest tube positioning, but inside her own skull, everything went very still. Kestrel 9 was not a phrase a civilian would know. It was not a phrase that appeared in any hospital protocol or nursing textbook or EMT training manual. It was a call sign from a particular communications network used by a particular community of people who operated in places that didn't have names on most maps. She had not heard those words in 3 years. She straightened up. Something shifted in her posture that had nothing to do with decision-making and everything to do with something older and more automatic than that. He has cardiac tamponade, she said. Not quietly this time. Not tentatively. The tracheal deviation is from mediastinal shift, not pneumothorax. You need to do a pericardiocentesis right now. Holt turned around. If she'd had time to be afraid of his expression, she might have been. But she was already moving to the ultrasound cart, already pulling it toward the bed, because if she could show him, if she could put the probe on the patient's chest and let the image do the arguing. Get her out of my trauma bay. Holt's voice was very calm. That was the version of him that was most dangerous. Security. Look at the ultrasound, Mara said. She had the probe in her hand. 30 seconds. Let me show you the pericardial sac. You are a staff nurse. You have no authority to operate diagnostic equipment without physician order, no authority to redirect treatment protocol, and no clinical standing to override my assessment. He stepped toward her. And you are done working in this department tonight. The door opened. 2 security guards came in, the kind of entrance that was clearly planned. Holt must have triggered a silent request at some point, or someone at the nursing station had seen the confrontation developing and made the call. Either way, they were there fast, and they were moving toward Mara with the practiced efficiency of people who did this more than occasionally. The patient's monitor alarm escalated to the continuous tone that meant the situation had changed fundamentally. His pressure's crashing, the resident said, and his voice had finally lost the careful neutrality. 60 over 40. 50. He's going into arrest, someone said. Mara didn't move toward the exit. The two security guards stopped because the patient had grabbed the bed rail, grabbed it with a grip that should not have been possible for someone with his oxygen saturation and blood pressure. And the sound he made was not loud, but it was the kind of sound that stopped movement in a room. A sound that carried authority even through the damage. Everyone looked at him. His eyes were on Mara. His jaw was set. He shook his head once, slowly, deliberately, at the security guards. "Her," he said. The word cost him something visible. Only her. Nobody moved for 3 full seconds. Then one of the security guards looked at Holt, and Holt's expression was a map of something complicated. Fury, certainty, the particular outrage of a man who has never once had a patient redirect his authority. And Mara made the decision while he was still working through it. She put the ultrasound probe on the patient's chest. The image came up on the screen, and it was exactly what she'd known it would be. A dark crescent of fluid wrapped around the heart like a fist, the cardiac chambers compressed, the heart struggling to fill between each beat with less and less success. Pericardial tamponade, textbook on the screen. Undeniable. "There," she said. She didn't say "I told you." She just said, "You need an echo-guided pericardiocentesis, subxiphoid approach. If you don't drain that fluid in the next few minutes, he arrests and doesn't come back." Holt looked at the screen. The resident looked at the screen. The second nurse in the room looked at the screen and then quietly went to the procedure cart and began pulling a pericardiocentesis kit without being asked. Holt looked at Mara. His expression had not shifted into anything that resembled gratitude or correction or recalibration. It had shifted into something colder and more considered. "Step back," he said. To her, not to security. She stepped back. She watched him take the kit from the nurse and work through the procedure, guided by the ultrasound she'd set up, using the image she'd produced, treating the condition she'd named. And she kept her face still and her breathing even and her hands loose at her sides because she had learned a very long time ago that being right was not the same as being safe. The drain went in. The fluid came out. Dark, considerable. The kind of volume that explained everything. The patient's pressure started climbing almost immediately. The monitor alarm changed its tone. The resident exhaled so hard it was almost a laugh. The patient's oxygen sat came up. 81, 86, 92. His hand released the bed rail. His eyes found Mara again across the room, and he raised 2 fingers. Barely, the smallest possible gesture, trembling with the effort, in something that looked very much like a salute. She gave him the smallest nod she had. Then she began documenting what she'd observed, because documentation was what staff nurses did, and she was, in this hospital, in this city, in this life, a staff nurse. And that was all she was allowed to be. Harrowfield Medical Center was not a cruel place by design. It was a large regional trauma center in a mid-sized city that had grown too fast and restructured too often. And the result was the kind of institutional culture where hierarchy had calcified into something that looked like competence from the outside. Clifford Holt had been at its center for 11 years. He had built the trauma program's reputation, secured its Level 1 designation, published enough research to keep the board impressed, and cultivated a department where his word functioned more like weather than opinion, something you adapted to rather than argued with. Mara Valdez had arrived 14 months ago. She'd come from a staffing agency initially, taken a per diem slot that turned full-time when a senior nurse left suddenly, and she'd kept her head down with a consistency that most of her colleagues read as shyness. She was competent, quiet. She did her job without drawing attention, which was exactly what she intended, and she deflected the occasional attempt at workplace friendship with the practiced vagueness of someone who had decided that closeness was a variable she couldn't afford. What nobody at Harrowfield knew, what she had arranged, carefully, for nobody to know, was that Mara Valdez had not always been a floor nurse in a Pennsylvania trauma center. She had been Army. Specifically, she had been a Special Operations combat medic attached to units whose mission profiles were classified at levels that made her nursing credentials look like a grocery list by comparison. She'd done 4 deployments across 2 theaters, accumulated a service record that her discharge papers didn't fully reflect, and she had come home from the last one carrying something she hadn't been able to put down. A formal investigation finding, an official reprimand, and the particular kind of institutional blame that follows a person even after they leave the institution behind. She didn't talk about it. She didn't explain it. She had rebuilt herself from the ground up. Nursing school, which she completed in 18 months by testing out of everything she already knew, licensure. A series of unremarkable positions in unremarkable hospitals, moving every year or so before anyone could look too closely. She was good at starting over. She'd had practice. The morning after the tamponade case, she came in for her shift and found a note in her locker from department administration. Dr. Holt had filed a formal complaint regarding her conduct during the previous evening's trauma response. She was suspended with pay pending a review of her clinical behavior and her qualifications to perform assessments outside her scope of practice. She read it twice, folded it, put it in her bag. Then she went to the charge nurse's station and completed her remaining documentation from the night before, because the documentation still needed to be done, and because she was not going to give anyone the satisfaction of watching her unravel over a piece of paper. The charge nurse, a woman named Bev who had worked at Harrowfield for 20 years and had the professional wariness that came from watching too many good nurses get ground up by the system, watched Mara work through the charting without saying anything for almost 10 minutes. Then she said quietly, "You saved that man's life last night." "I made a suggestion," Mara said. "Dr. Holt performed the procedure." Bev looked at her for a long moment. "That's not what the resident wrote in his personal notes. Residents' personal notes aren't charted documentation." "No," Bev agreed. "They're not." She paused. "The patient's been asking for you." Mara's hands went still on the keyboard. "He's in the ICU," Bev said. "He asked one of the night nurses if the woman who'd been in the trauma bay was still working today. Described you specifically." Mara thought about Kestrel 9, thought about the two-finger salute, thought about the way he'd looked at her across a trauma room like someone who'd been looking for a long time and had just found what they were looking for. "I'm suspended," she said. "I shouldn't be on the floor." "You're completing documentation. That's different." "Bev, I'm just saying what the policy technically allows." Bev's expression was neutral, in the careful way of someone who is choosing their neutrality deliberately. "ICU's on the 3rd floor. You know where it is." Mara logged out of the documentation system. She sat for a moment with her hands in her lap, looking at the wall above the station. She had spent 3 years being careful, 3 years of controlled geography, of knowing exactly how much space she took up in any given situation and staying inside it. She had gotten very good at not being remarkable, which was a specific and underappreciated skill, and she'd gotten good at it because the alternative, being seen, being known, being the person she used to be, had ended in a way she was still living with. The patient in the ICU had said 2 words that meant he was part of a world she'd left. That was either a reason to go to him or a reason to stay very far away, and she knew which option the careful version of herself would choose. She was on the elevator to the 3rd floor before she'd consciously decided to move. ICU bed 7 had a security presence outside it that was inconsistent with standard hospital protocol. Not uniformed hospital security, 2 people in civilian clothes with the specific kind of posture and peripheral awareness that Mara recognized immediately and filed away without expression. One of them stepped slightly forward as she approached. Not blocking, just present. "Mara Valdez," she said. "I was in the trauma bay last night." The taller of the 2 looked at her with the evaluating attention of someone running a rapid assessment. Then he stepped aside. She pushed through the glass door. The patient looked considerably better than he had 12 hours ago, which was not a high bar. 12 hours ago, he'd been minutes from cardiac arrest. But even accounting for that, his recovery rate was notable. He was sitting partially upright, the oxygen mask replaced with a nasal cannula, monitoring lead still attached, an IV running. His face in daylight was different than it had been in the chaos of the trauma bay. Calmer, more defined. He had the kind of bone structure that looked like it had taken damage over time and absorbed it rather than breaking. His eyes tracked her from the door to the bedside without any of the post-anesthesia vagueness she might have expected. "Valdez," he said. His voice was rough but steady. "You cut your hair." She stopped. "Do I know you?" "Kelso Valley, 2019. You were attached to 2nd Battalion, 4th Group. I was running a different op through the same corridor, and we shared a FOB for 11 days. He paused. You beat Martinez at cards 4 nights in a row, and he still hasn't forgiven you. She remembered a forward operating base in a valley that didn't have an official name on most briefings. She remembered 11 days of rotating watch schedules and the particular discomfort of sharing logistics with a team whose mission she wasn't fully briefed on and who weren't fully briefed on hers. She did not remember his face. People looked different in full kit, in low light, at high stress, but she remembered the team's general bearing, and looking at him now, she believed it. "You were Kestrel Element," she said. "Commander Douglas Ferris, Special Operations." He said it simply, without the weight some people put on that kind of introduction. "And you were Doc Valdez, who apparently is now working as a floor nurse in Dunmore, Pennsylvania. People change careers." "People do," he said. He watched her. "You knew what was wrong with me before anyone else in that room." Tamponade presentation isn't that unusual in blast trauma. "No," he agreed, "but most people in that room had more formal training than you're currently credentialed for, and they missed it." He paused again. The monitoring equipment beeped steadily. "The guy in charge tried to have you thrown out." "That's a departmental matter." Ferris's expression shifted, not into sympathy exactly, but into something more considered. "They suspended you." She didn't respond. "I want to be clear about something," he said. His voice had changed slightly, not softer, more direct. "I'm not here by accident. I wasn't just passing through Dunmore. I was in this city for a reason, and the explosion that put me in your trauma bay was not a random event." He held her gaze. "I also want to be clear that I'm going to make sure what happened to you last night doesn't stand. The suspension, the complaint, none of that is going to hold. Commander Ferris, Doug." "I don't need that." She said it carefully, meaning it. "I know how to handle institutional processes. I've done it before." Something in his expression registered that sentence and noted it. "I know you have," he said quietly. "That's actually part of what I need to talk to you about." The monitoring equipment beeped. Outside the glass, one of his people shifted position. Mara looked at Douglas Ferris, at the man who'd called her by a call sign she hadn't heard in 3 years, who knew her from a valley with no official name, who had looked across a trauma room full of doctors and found her specifically. And she felt the particular sensation of something she'd thought was finished beginning, against her will and without her permission, to move again. "What did you need to talk to me about?" she said. He didn't answer immediately. He looked at the window, then back at her. "The device that hit my vehicle," he said. "It wasn't an IED. It wasn't random. It was a shaped charge, military grade, placed by someone who knew my route." He stopped. "And the reason I was in Dunmore in the first place was because I was following a thread that connects to something that happened on your last deployment." The room felt smaller. "My last deployment is closed," Mara said. Her voice came out level. "Officially adjudicated. I have the paperwork." "The paperwork is wrong," Ferris said simply, "and I can prove it, but I need you to not disappear first." The door to the ICU room opened. Not one of his people this time. A hospital administrator. Mara recognized the woman, Sandra Kell, Associate Director of Clinical Standards, who stepped in with the tight expression of someone delivering a message she didn't write but had been instructed to convey. "Ms. Valdez." Kell's eyes went to Mara and stayed there with the particular focus of institutional correction. "Your access badge has been deactivated effective as of 1 hour ago. You're not authorized to be on this floor or in this unit. I'm going to have to ask you to come with me and surrender your badge at HR." Mara looked at Kell. She looked at the badge clipped to her scrub pocket. She looked at Douglas Ferris, who was watching the administrator with an expression that was absolutely still. "Ms. Valdez saved my life last night," Ferris said. His voice was conversational. "I'd appreciate it if the hospital extended her some basic professional courtesy while I'm still a patient here." "That's not within my authority to—" "I understand," he said. "I'll be making some calls this afternoon to people who do have that authority." He looked at Kell without hostility and without any softness either. "It would help me to know that Harrowfield is the kind of institution that takes those calls seriously." Kell's expression shifted in the complicated way of someone recalibrating their position in real time. She looked at Mara, then back at Ferris. Then she said stiffly, "I'll need to consult with Dr. Holt and the department director." Of course, Ferris said. Kel left. Mara stood in the ICU room in the fluorescent light with the monitoring equipment beeping its steady rhythm and the two people outside the glass watching the corridor and Douglas Ferris watching her, and she thought about closed doors and adjudicated paperwork and the specific quality of silence that follows a person out of a building when they've been told their version of events doesn't match the official record. What happened on that deployment, she said. Not because she didn't know. She knew every detail with the precision of something she'd replayed too many times, but because she wanted to hear what he knew. Ferris was quiet for a moment. Then he said, 3 soldiers died in a vehicle explosion. The investigation found that the field medic on site failed to identify a survivable injury in time to render effective aid. That medic was you. He paused. What the investigation didn't find, because the evidence was removed before the inquiry team arrived, was that those 3 soldiers were driving equipment that should never have been in the field, equipment that had failed its safety certification, equipment that was fielded anyway by someone with enough authority to override the flagged report, because a contractor needed the contract to close on time. The monitoring beeped. The explosion wasn't a field casualty, he said. It was a product failure, and the people who let that equipment into the field needed someone to blame. Mara felt the thing she'd spent 3 years building around that memory, the controlled distance, the deliberate not thinking, the practiced neutrality she'd wrapped it in like insulation, develop a fracture that started small and went deep. Who's the contractor? She said. Ferris's expression didn't change, but something in his eyes did. That's exactly the right question, he said, and that's exactly why someone tried to kill me before I could finish answering it. The name sat in the room between them like something with weight. Mara didn't ask him to repeat it. She didn't need to. The word contractor had a specific gravity when it came attached to a military equipment failure and 3 dead soldiers and an investigation that had arrived after the evidence was already gone, and she had spent 3 years trying not to think too carefully about that gravity because thinking about it carefully led to a place she couldn't afford to live. You said someone removed evidence before the inquiry team arrived, she said. How do you know that? Because I was supposed to be part of that inquiry team, Ferris said. I was pulled off the assignment 48 hours before deployment, reassigned, no explanation given, which at the time I accepted because that's how it works sometimes. He shifted against the pillows, and she could see that movement cost him something. The tamponade had been resolved, but the surrounding trauma hadn't, and his body was doing the slow accounting that bodies do after violence. I didn't connect it until 8 months later when a friend of mine in JAG sent me a document she shouldn't have sent me. Preliminary findings from an internal review that never became a formal investigation. The kind of document that gets written and then gets very quietly filed somewhere dark. What did it say? It said the vehicles your unit was operating had failed stress fracture testing at the component level 6 weeks before they were fielded. The failure report was logged. The contractor submitted a waiver request to the procurement office. The waiver was approved by a deputy director named Alan Voss, who at the time was also on the advisory board of the company submitting the waiver. Mara's jaw tightened. Conflict of interest. Textbook. But Voss had enough institutional cover that even if someone looked directly at it, they'd have needed a clean evidence chain to move on it. And the equipment failure itself, 3 soldiers, remote location, nobody left to give a first-person account except you, that got packaged as field medic error and closed. He looked at her steadily. You were convenient. The word landed the way true things sometimes do, not with shock because some part of her had known the shape of it for years, but with the particular exhaustion of having a suspicion confirmed after you've already paid the cost of being wrong about it. I've been looking at Voss for 14 months, Ferris continued. Quietly, off book, with 2 people I trust. 3 weeks ago, we got close enough to something that someone noticed. My road into Dunmore was known to maybe 4 people, and the device placement required advanced knowledge of timing. He paused. One of those 4 people is someone I've trusted for a long time, and I'd really prefer to still trust them, so I haven't finished that calculation yet. And what does any of this have to do with me specifically, right now? Because the evidence I've been building includes a forensic reconstruction of what actually happened to those vehicles, what the actual failure point was, the physical documentation of that, The original component testing records, the waiver paper trail, the communication chain between Voss's office and the contractor, is in a location I can't currently access from this bed. He didn't smile, but something in his expression acknowledged the situation's irony. And because you were the medic on that site, your testimony is the missing element that turns a document trail into a prosecutable case. You're not just a witness, Valdez, you're the witness who survived. She had been standing since she entered the room. She realized now that she was very tired, in a way that had nothing to do with her shift or the hours or the physical demands of the night before. It was the specific tiredness that comes from carrying something for a long time and having someone point at it. She sat down in the chair beside the bed, not because she'd decided to stay, but because her legs had made a unilateral decision about the matter. Outside the glass, the corridor had shifted slightly. One of Ferris's people had moved to a position with a better sightline to the elevator bank. She noted it without looking like she was noting it. "The suspension they hit me with," she said. "Holt's complaint." "Will not survive contact with what's coming," Ferris said, "but I need a day or two to make the right calls, and I need you to not do anything that makes it easier for the hospital to escalate the situation before then. So you need me to be quiet and wait." "I need you to be strategic," he said, "which I suspect you're actually good at." She looked at the window, at the thin winter light coming through the hospital glass, which had the quality that February light always had, present but not warm, illuminating without comforting. She thought about the last 3 years, about the careful geography of them, about the way she'd rebuilt something small and functional and manageable from the ruins of a career she'd loved and a life she'd had to leave. She thought about 3 soldiers whose names she still said sometimes, quietly, when she was alone, because saying names was one of the few things that felt like it still counted. "Tell me about the evidence location," she said. "Ibash sa..." She left the ICU. 20 minutes later, badge surrendered at the HR window as instructed, personal locker cleaned out by 2:15 in the afternoon. The HR coordinator, a young man named Pete, who clearly found the whole thing uncomfortable, was professional enough not to make it worse than it was. He handed her the formal suspension notice, which outlined the complaint, the review process, and her right to respond in writing within 14 days. 14 days. She drove back to her apartment, which was a second-floor unit in a building on Carver Street that she'd chosen specifically because it had 2 exits and parking that wasn't visible from the main road, which was the kind of thing you noticed about apartments when you had the training she had. She'd furnished it in the deliberate, minimal way of someone who was always half prepared to leave. Nothing that couldn't be packed in a car in under an hour, nothing that required assembly or disassembly, nothing she would grieve losing. She sat at the kitchen table with the suspension notice in front of her and her phone face down beside it, and she spent approximately 3 minutes being completely still, which was her version of what other people did when they needed to think. Then she opened her laptop and began researching Alan Voss. He wasn't hard to find publicly. Deputy director level, Defense Procurement Authority, 17 years of service, the kind of clean federal profile that was assembled with care. Civic appearances, professional affiliations, committee memberships that demonstrated appropriate dedication to public service without revealing anything specific about what he actually did. 3 years ago, he'd left federal service and moved into a senior advisory role at a private consulting firm that worked primarily with defense contractors. The kind of transition that was common enough to be unremarkable and specific enough to be worth looking at. She found the contractor name in a procurement database that was technically public but practically obscure. Halcyon Systems Group, a mid-size manufacturer of armored vehicle components. She cross-referenced the timeline Ferris had given her against Halcyon's contract history and found the award date, the component specifications, and the fielding timeline without difficulty. She also found, in a trade publication from 4 years ago, a brief profile of Halcyon's then CEO at a defense industry conference, shaking hands with a man identified in the caption as a senior official from the Defense Procurement Authority. The man's face was slightly turned, but the name in the caption was Voss. She stared at that photograph for a long time. Her phone buzzed. Unknown number, but the area code was DC. She answered. "This is Mara Valdez." "Ms. Valdez?" The voice was a woman's. controlled, efficient, the precise diction of someone who spoke carefully as a professional habit. My name is Agent Priya Okafor. I'm with the Department of Defense Inspector General's office. I understand you spoke with Commander Ferris this afternoon. Mara's hand tightened slightly on the phone. How do you know that? Because I've been running a parallel investigation into Halcyon Systems Group for 7 months, and Commander Ferris is one of the people I've been coordinating with. When he was hospitalized, I was notified. A brief pause. I also know about the incident in the trauma bay last night, and about your suspension. Am I supposed to be impressed that you know things, Agent Okafor, or is there a point coming? There was a short pause on the other end that might have been recalibration. The point is that what happened to those 3 soldiers in your unit has been on our radar for longer than you know. And the reason it hasn't moved is that every time we get close to the evidence chain, something happens. A witness becomes unavailable. A document gets reclassified. Someone's access gets quietly revoked. Another pause, more deliberate. You've been unavailable for 3 years, Ms. Valdez, deliberately so, which I understand. But Commander Ferris's situation has accelerated our timeline, and I need to know if you're willing to come in. Come in where? I have a field office in Dunmore, not a federal building. A working space I use when I'm running something that benefits from not being in a federal building. Mara looked at the photograph on her laptop screen, at the handshake, at the caption with Voss's name. You said Ferris is someone you coordinate with, she said. Does he know you're calling me? He suggested it. She thought about the way Ferris had looked at her when she'd said my last deployment is closed. The careful thing in his expression that wasn't pity and wasn't calculation, but was somewhere between them. The look of someone who knew the full cost of a thing and was asking her to revisit it anyway. When? She said. Tonight, if possible. I know that's fast. Tonight is fine, Mara said. Send me the address. Okafor's working space was above a dry cleaning business on Renner Street, which Mara appreciated for its lack of drama. She climbed the stairs at 7:45 and found the door unlocked and the lights on, and Okafor already at a folding table covered in documents, looking up when Mara came in with the measured attention of someone who had been briefed on her and was now comparing briefing to reality. Okafor was somewhere in her mid-40s, compact, wearing a dark sweater and reading glasses pushed up on her head. She had the kind of face that gave nothing away as a default setting. Sit, she said, and it wasn't rude, just direct. Mara sat. For the next 90 minutes, they went through it methodically. Not Okafor interrogating her, but both of them building the same structure from different angles, filling gaps where one person's knowledge ended and the other's began. Okafor had the procurement documentation, the waiver chain, the contract timeline. Mara had the on-site account. What the vehicles had looked like before the explosion, the specific way the blast had propagated, the details of those 90 minutes that she'd never written down anywhere because writing them down would have meant sitting with them, and she hadn't been able to do that. She told it now without stopping. Flat, precise, the way she'd learned to debrief. She was aware that she was doing something she'd decided 3 years ago she would never do, and she was aware that the decision to do it anyway had been made somewhere she didn't have full access to, and she let that be true without examining it too closely. When she finished, Okafor was quiet for a moment. The vehicle that failed, she said. The fracture point. You said it was the lower hull junction, left rear. Yes. We have testing documentation from Halcyon's internal records that shows that exact point failed stress testing at 73% of specified load tolerance. The waiver Voss signed approved it for field use at up to 90%. She turned a document toward Mara. He signed it 11 days before your unit took those vehicles into the field. Mara looked at the document, at the signature, at the date. Something in her chest did something she couldn't name precisely. What do you need from me? She said. A formal statement, signed, on record, with you identified by your actual service record, not the reduced version that went into the investigation findings. Okafor looked at her steadily. That means your full record becomes part of this file. Your actual qualifications, your deployment history, the things your current employer clearly doesn't know about you. Mara thought about Harrowfield, about Clifford Holt, about the suspension notice sitting on her kitchen table with its 14-day response window. "That's going to complicate some things," she said. "Yes," Okafor said simply. "It will. Do you want to do it anyway?" Mara looked at the document again, at the date, at 11 days. "Yes," she said. She didn't sleep much that night, not because she was anxious in the way that prevents sleep, but because her mind was doing the thing it did when a situation had shifted, running through variables, tracking lines of cause and effect, updating its map of what was true and what was possible. She lay in the dark in her minimal apartment and let it run, and by 4 a.m. had arrived at something that felt less like a plan than like a reckoning with what was already in motion. She was at the hospital at 8 the next morning. Not to work. Her badge was deactivated. She was there because Ferris had sent her a message through Okafor at midnight that said simply, "Need to brief you on what came in overnight. Come when you can." His security people had apparently been updated to expect her because the one outside the ICU door gave her a nod that meant clearance without requiring her to explain herself. She pushed through the glass door. Ferris was sitting fully upright now, the nasal cannula gone, and there was a man in the room she hadn't seen before, standing near the window in civilian clothes, late 50s, with the bearing of someone who had spent a long time being the most senior person in whatever room he entered. He turned when Mara came in, and his eyes did the same rapid assessment that Ferris's people did, except this one also had the specific quality of someone making a judgment she'd later have to live with. "Valdez," Ferris said, "this is Colonel Warren Sloan, retired. He's been advising my inquiry from the outside." Sloan gave her a nod that was not unfriendly and not warm. "I've read your service record," he said. "The real one." "Then you know more about me than most people in this building," she said. "That's about to change." He moved to the folding chair near the bed, the informal command of someone who didn't need to announce that they were in charge. "Okafor briefed me on your statement last night. Combined with what Ferris has been building, we're past the threshold for a formal referral to the IG's prosecutorial division. We move on that in the next 48 hours. "What does that mean in practice?" she said. "It means Alan Voss gets a visit he's been avoiding for 3 years. It means Halcyon's current contracts go into review. It means the investigation findings on your deployment get formally reopened." He looked at her without softening it. "It also means the people who've been watching Ferris's inquiry are going to know that the evidence chain is now in federal hands, and some of those people are going to make decisions about what to do about that." "Meaning they become unpredictable," Mara said. "Meaning the next 48 hours are the most exposed part of this for everyone involved." Sloane's expression didn't change. "Including you." She absorbed that. "Is Ferris safe here?" "Safer than he was," Ferris said from the bed. "My people have the floor." "The hospital doesn't know what's happening," she said. It wasn't a question. "The hospital administration knows there's a federal interest in the case, which is why your suspension is in a certain amount of bureaucratic limbo this morning," Sloan said. Holt filed his complaint. The administration started to process it. Then they received a call from a federal attorney's office this morning asking them to hold all personnel actions related to the night of the third pending a review. A brief pause. "They don't know exactly what that means yet, which means they're doing what hospital administrations do when they're uncertain. Nothing." Mara thought about Holt, about the specific cold fury in his face when she'd put the ultrasound probe on Ferris's chest, about the 11 years he'd spent being the loudest voice in every room. "He's not going to accept that," she said. "No," Sloan agreed. "He's not. He's already called 2 board members this morning." Her phone buzzed. She looked at it. An unknown number. Different area code than Okafor's. She showed it to Ferris without answering. Something in his expression changed, just slightly. "Answer it," he said. She answered, put it on speaker. "Miss Valdez." A man's voice, smooth, deliberate, the kind of voice that was comfortable with long pauses. "I think we should talk before this gets further than it needs to." Sloan had gone very still. Ferris was looking at the phone with an expression that had closed down into something careful and absolutely alert. "Who is this?" Mara said. "Someone who has a significant interest in the situation you've inserted yourself into," the voice said, and someone who wants you to understand that what Commander Ferris has told you is a version of events, not the version. I'm listening, she said. She kept her voice level. The 3 soldiers who died in your unit's vehicle were the result of a genuine operational miscalculation. The equipment in question had been flagged, yes, but the decision to field it was made under time pressure by people acting in what they believed were the best interests of the mission. What's being constructed now, this narrative of criminal negligence and cover-up, is being built by people with their own agenda. What agenda? Commander Ferris has been running an unauthorized inquiry that conflicts with an active federal operation. His activities have compromised 2 ongoing intelligence assets, and the people building a case around the equipment failure are doing so because it serves a different political objective entirely. A pause. I'm telling you this as a courtesy, Ms. Valdez, because you're someone who got caught in something 14 months ago that you didn't cause, and I'd prefer you not get caught in something again. That's a thoughtful concern, she said. Who are you? Silence. If you'd like to speak further, come alone. I'll be at the Braddock Hotel, room 412, until noon. The line went dead. The room was quiet for about 4 seconds. Alan Voss, Sloan said. Not a question. Ferris nodded once. Mara looked at the phone in her hand, at the dead screen. She thought about the voice, the smoothness of it, the particular way it had constructed a reasonable-sounding alternative to the truth, the targeted use of her deployment, her guilt, her 3 years of carrying something that had been given to her to carry by the people this man worked for. He called me, she said, which means he knows who you are and what you told Okafor last night, Ferris said. He was watching her with something that was not quite alarm, but adjacent to it. Okafor's office is clean. I'd stake a lot on that. Which means the leak is somewhere else, Sloan said. His voice was even. We need to move our timeline forward. How far forward? Mara asked. The referral goes in today, this afternoon. Sloan stood, already pulling out his own phone. Okafor needs to know about this call. There's something else, Mara said. Both men looked at her. He said Ferris's activities compromised 2 intelligence assets. He said it like it was a fact, not an accusation. She paused. That level of specific operational knowledge, that's not a contractor. That's someone inside. The room was quiet. Ferris looked at the window. She could see the thing he'd said the day before. 4 people knew my route, and I'd really prefer to still trust one of them. Land visibly in his expression, a reckoning he'd been avoiding arriving. I know, he said quietly. Her phone buzzed again. This time it was a number she recognized, the hospital's main administrative line. She answered it, and the voice on the other end was Sandra Kell, the Associate Director of Clinical Standards, speaking with the careful neutrality of someone reading from a prepared statement. Ms. Valdez, I'm calling to inform you that Dr. Holt has escalated his complaint to the State Nursing Board and filed a formal request for an emergency suspension of your nursing license, citing patient safety concerns. The board has agreed to conduct an expedited review. You'll receive formal notice within the hour. A pause. I want to be clear that the hospital is not initiating this action. Dr. Holt has filed this as a personal complaint through his own professional standing, but I'm calling to make sure you're aware. Mara kept her voice even. Thank you for the courtesy, Ms. Kell. She ended the call. Sloan and Ferris were both watching her. He went to the nursing board, she said. Emergency review. Expedited. Ferris closed his eyes briefly. Not despair, just the specific fatigue of watching a situation escalate according to its own logic. How long for the board to move on it? Sloan asked. Expedited review means a hearing within 7 to 10 days, she said. If you convince them it's a patient safety emergency, they can impose a temporary suspension of practice rights while the hearing is pending, which meant that if she lost her license, even temporarily, even pending appeal, her ability to work anywhere in healthcare would be gone. The careful reconstruction of the last 3 years, the quiet, functional, manageable life she'd built from the ruins of the last one. He's trying to cut your legs out from under you before we can move, Ferris said. Yes, she said. He is. She put her phone in her pocket. She stood in the ICU room with its beeping monitors and its winter light and its complicated arithmetic of what was coming and what it would cost. And she thought about Alan Voss in room 412 of the Braddock Hotel, and the smooth voice on the phone, and the three names she still said quietly when she was alone. And she thought about Clifford Holt filing papers with a nursing board while a federal investigation was accelerating around him without his knowledge. "I want to go to that meeting," she said. Sloane looked at her sharply. "Absolutely not." "I'm not going alone," she said, "and I'm not going to negotiate with him. But if Voss reached out directly, if he's willing to be in a room with me, then he's more worried than he's letting on. And a man who's more worried than he's letting on makes mistakes in conversation that he doesn't make in writing." Ferris was looking at her with an expression she couldn't fully parse. "She's not wrong," he said to Sloane. "She's also not a federal agent," Sloane said. "No," Mara said. "I'm a nurse with a suspended badge and a nursing board complaint and nothing left to lose by walking into a hotel room." She looked at Sloane steadily. "Wire the room. Put people at both exits. Let me go in and let him talk and see what he says when he thinks he's managing me." Sloane looked at her for a long moment. His expression was the kind that came from a long career of making decisions where every option had a cost. "If I say yes," he said slowly, "you follow every instruction I give you, in real time, without question." "Yes." "If I say pull out, you pull out. No judgment calls." "Yes." He looked at Ferris. Ferris gave him a small nod that was not quite agreement and not quite authorization, but was something that carried weight with Sloane anyway. "Give me an hour to set it up," Sloane said. He moved to the door, stopped, turned back. "For what it's worth, Ms. Valdez, what you did in that trauma bay 2 nights ago, I've read the attending's complaint and the resident's notes. The complaint is going to fold the moment anyone looks at it honestly." He said it without comfort and without softening, just as a statement of what was true. Holt knows that. It's why he went to the nursing board instead of trusting the hospital process. He left. Ferris looked at her. She looked at him. "You don't have to do this," he said. "3 soldiers," she said simply. He nodded once. He understood what that meant. She was at the door when his voice came again, quieter. "Valdez." She stopped. "The person who might have given Voss my route," he said. He was looking at the window, not at her. "I've been running with this team for 6 years. If it's who I think it is—" He stopped, pressed his jaw together. "Just watch Sloane." She looked at him, at the careful stillness of his face and the thing underneath it that he hadn't finished saying. "Is he who you think it is?" she said. Ferris didn't answer, which was, in its own way, an answer. She walked out of the ICU, took the elevator to the ground floor, stepped out into the February cold of Dunmore, Pennsylvania, and stood on the sidewalk outside Harrowfield Medical Center with the wind coming off the Lackawanna Valley and the weight of what she'd just agreed to walk into pressing down on her shoulders. Her phone buzzed. This time it was Okafor. She answered. "I just got off the phone with Sloane, Rick," Okafor said, and her voice had lost its usual evenness. "He told me about the meeting, about what you're planning to do." A pause. "There's something he didn't tell you, something I found in the last hour that I need you to know before you walk into that hotel room." "Tell me," Mara said. "Alan Voss isn't in Dunmore alone," Okafor said. "He came with someone whose name is in our file. Not as a suspect, as a federal employee with investigative authority over this exact case." The cold pressed in. "Who?" Mara said. Okafor said a name, and Mara stood very still on the sidewalk outside the hospital while everything she thought she understood about the last 48 hours rearranged itself into a shape she hadn't seen coming. The name Okafor said was Marcus Sloane, not Alan Voss. Not some external operative with a contractor badge and a financial motive. Marcus Sloane, Warren Sloane's son, who worked as a senior investigative liaison for the Defense Accountability Office, whose name appeared in Okafor's file not as a suspect but as a cleared federal employee with direct oversight access to the IG investigation into Halcyon Systems Group. Mara stood on the sidewalk and let the wind hit her while she processed that. "How certain are you?" she said. "Certain enough that I'm telling you before you walk into a hotel room with his father setting up the wire." Okafor's voice was controlled, but the tension underneath it was audible. Marcus has had read access to this investigation for 4 months. If Voss knew your statement, if he knew Ferris's route, if he knew enough to make a phone call this morning within 2 hours of our meeting, Marcus is the most direct explanation. Does Warren know? I don't know. That's what I can't read. It's possible Warren is completely clean and his son acted alone. It's possible Warren knows and has been managing both sides of this. A pause. It's also possible I'm wrong, and there's another explanation I haven't found yet. But you don't think you're wrong? No, Okafor said. I don't. Mara watched a hospital employee cross the parking lot with a coffee cup and the specific shuffle of someone mid-shift. The ordinary motion of an ordinary morning running alongside everything that was not ordinary. If I go into that hotel room with Warren Sloan running my wire, she said, and he's protecting his son, he can cut your feed, misdirect the exit teams, or simply fail to move when he needs to move. Okafor let that sit. I'm not saying don't go. I'm saying don't go with his setup. Then whose setup? Mine, Okafor said. Give me 40 minutes. Don't call Sloan. Don't go back upstairs. Just get in your car and drive to Renner Street. Mara looked up at the hospital building, at the third-floor windows where the ICU was, at the invisible architecture of who was watching what from where. Ferris, she said. He half warned me about Sloan last night. He said watch Sloan like it was something he couldn't finish saying. Which means Ferris suspects but doesn't have confirmation. Which means I need you to not tip Sloan that anything has changed. Okafor's voice tightened slightly. Can you do that? Yes, Mara said. And she could. She had done harder things than pretending normalcy under pressure. And she had done them in places where the cost of failing at it was measured differently than it was here. She got in her car. Passint. Okafor's setup was faster than 40 minutes and less elaborate than Mara had expected, which on reflection made sense. Elaborate meant more people, and more people meant more surfaces for information to leak from, and Okafor had just learned something about what leaks cost. 2 agents Mara hadn't met before, a woman named Torres, who was quiet and specific in the way that meant genuine competence, and a man named Reyes, who had the build of someone who did regular physical work and the eyes of someone who paid attention, wired her in the dry cleaning shop's back room with a transmitter that sat against her sternum under her shirt and a secondary audio device built into the frame of her glasses that she'd been handed without ceremony. Room 412, Torres said. He'll have at least one other person in there, maybe 2. Don't sit with your back to the secondary exit. I know how to do this, Mara said. Torres looked at her with the evaluating neutrality of someone who neither confirmed nor contradicted that assessment. If we need to pull you, you'll hear a double tone through the glasses. That means you finish your sentence, stand up, and move to the door without running. And if I don't hear the tone but the situation changes? Then you use your judgment, Torres said, which was the most honest answer Mara had gotten from anyone that morning. Okafor walked her to the door, stopped her there. Voss is going to try to make you feel like the reasonable option is to step back, to let the federal process work without your statement, without your direct involvement. She held Mara's gaze. Don't let him reframe what you're doing. You're not inserting yourself into something. You've been in this since the day those vehicles were fielded. I know, Mara said. She walked to the Braddock Hotel alone. The lobby was the kind that belonged to a mid-level business hotel. Functional, clean, specific to no particular city or region. Mara crossed it without looking at the front desk and took the elevator to the 4th floor and walked the corridor to 412 with her pulse at a rate that was elevated but not problematic, which was a distinction she was aware of making with the clinical part of her brain that never fully stopped running numbers. She knocked. The door opened, and it wasn't Voss. It was a man she didn't recognize. Mid-40s, compact, the deliberately ordinary appearance of someone whose job required them not to be remembered, who looked at her face and stepped back to let her in without speaking. The room was a standard double. Voss was sitting in the chair by the window, and he was smaller than she'd expected from the phone voice, a trim man in his early 60s with the careful presentation of someone who had spent a career being underestimated by people who looked at his size before his resume. He was well-dressed in the specific way of someone who had learned that presentation was a form of argument. There was no one else visible. She noted the bathroom door was closed. "Ms. Valdez," Voss said, "thank you for coming." "You asked," she said. She sat in the chair across from him, not the one closest to him, not the one nearest the bathroom. And she kept her jacket on because the transmitter was underneath her shirt, and jackets created a layer of acoustic separation that she preferred. "I'll be direct," he said. "I appreciate that quality in people, and I extend it where I can." "Go ahead." The investigation that Agent Okafor is running and that Commander Ferris has been contributing to is built on a documentary foundation that is going to be significantly more complicated than they've represented to you. The waiver I signed for the Halcyon component was standard practice under the parameters of the deployment timeline. I've consulted with my attorneys, and I'm prepared to demonstrate that through the appropriate federal channels. He looked at her without aggression, which was itself a form of pressure. Your testimony, as they've framed it, is intended to be the human element that makes a technical argument feel like negligence. What you experienced on that deployment was real. What you lost was real. But the causal chain they're building is not what they've told you it is. Mara looked at him. She thought about 11 days, about a stress fracture test that failed at 73%. "What is it then?" she said. "A political prosecution," he said simply. "There are people in federal oversight who have wanted to restructure procurement authority for years. Halcyon's contract is an instrument, a vehicle, if you'll forgive the word, for demonstrating systemic failure in a way that justifies that restructuring. Your 3 soldiers are collateral to that argument. I am collateral to that argument." He paused. "And so, frankly, are you." It was smoothly constructed. She could see the architecture of it. Take the genuine complexity of federal bureaucratic motivation, which was real, and use it to create enough doubt about the specific evidence to make a reasonable person hesitate. She'd seen this done before, in a different context with different stakes, and she'd watched people hesitate, and she'd watched what the hesitation cost. "The testing document," she said, "the one showing the component failed at 73%. Your signature on the waiver approving it for 90% load conditions. That's not a political argument. That's a number." Something in his expression shifted. Not much, but enough. "Testing documents from that period are subject to interpretation. Methodological disputes about load simulation standards. The lower hull junction failed," she said. "Left rear. I was close enough to see the fracture pattern before the secondary blast. I didn't know what I was looking at then. I do now." Silence. "That's your testimony," he said. Quieter now. "That's what happened," she said. He looked at her for a moment. Then he looked at the closed bathroom door. A glance, brief, the kind that a careful man makes when he wants to check something without appearing to check it. And Mara felt the back of her neck go cold in the specific way that meant her body had processed something her conscious mind was still catching up to. The bathroom door opened. The man who stepped out was in his mid-30s. He had Warren Sloane's bone structure around the eyes and jaw, softer, younger, with the particular look of someone who had built a career in institutional spaces and was used to being the most educated person in the room. He was holding a phone, and he was looking at Mara with an expression that had too many things in it to read cleanly. "Marcus Sloane," Mara said. He stopped. "You know who I am," he said. "I know what you are," she said, which was a different thing, and she watched him understand that. "Ms. Valdez." His voice was careful. "I want to be very clear that my being here does not constitute anything improper. You have read access to the IG investigation that's building a case against the man you're standing next to," she said. "You knew my statement before Okafor had finished filing it. You knew Ferris's route." "That's an accusation with no—" "I'm not accusing you of anything," she said. "I'm describing what I know. Those are different things." The compact man near the door had shifted slightly, not toward her, but his weight had redistributed in the way that preceded intentional movement, and she logged it without moving her eyes off Marcus. "I think this conversation has reached its useful limit," Voss said. His voice had changed, still smooth, but with something underneath it now that was less managed. "I want you to think carefully about what you're doing, about what it costs you personally. Your nursing license is in front of a review board. Your employment is suspended. Your service record, the real one, is about to become part of a federal file that will be contested and litigated and examined in ways that will follow you regardless of the outcome. I know, she said. Then you understand that stepping back from this, letting the federal process work without your direct involvement, protects you. It protects you, she said. Those are not the same thing. He looked at her. For the first time, his expression had something in it that was neither smooth nor managed. A brief, unguarded flash of something that might have been respect if the circumstances were different, and might have been something colder if they stayed what they were. In her glasses, she heard a double tone. She stood up. "Thank you for meeting with me," she said, which was not what she felt but was what the situation required. She moved to the door. The compact man was still near it. "Ms. Valdez," Marcus said. She stopped. "My father doesn't know I'm here." His voice had changed again. The institutional layers had dropped out of it, and what was left was younger and less certain. "He doesn't know He doesn't know." She looked at him. "Then you should tell him," she said, and she walked out. Torres was in the corridor, appearing from a housekeeping alcove with the casual efficiency of someone who had been there long enough that the hotel staff had stopped noticing her. She fell into step beside Mara, without speaking until they reached the stairwell door. "We got it all," she said. "Voss on record, Marcus on record. Okafor's already with the prosecutorial team." "Marcus said his father doesn't know," Mara said. Torres's expression didn't shift. "We'll establish that through the process." "Is Warren Sloan clean?" "We don't know yet." She pushed the stairwell door open. "But if he is, finding out his son has been feeding a suspect through his investigation is going to be—" She stopped, chose a different word. "Significant." They went down the stairs and out through a service exit onto the alley behind the hotel and into a waiting car where Reyes was driving and Okafor was in the passenger seat with her phone to her ear already, talking in the tight shorthand of someone managing multiple moving pieces simultaneously. She ended the call as they pulled out. "The referral is in," she said, turning to look at Mara in the back seat. "Voss is going to be notified within the hour. At that point, he becomes a named subject in an active federal investigation, which restricts what he can do and who he can contact." "Marcus Sloan?" Mara said. "We're going to talk to Warren first." Okafor's jaw was set in a way that suggested she was managing something personal about that particular conversation. "He deserves to hear it before we move on Marcus formally." "What about Harrowfield, the nursing board complaint?" "The referral authorizes a federal stay on collateral proceedings that could interfere with witness availability or testimony integrity," Okafor said. "Holt's complaint qualifies. I'm filing the stay request this afternoon." Mara sat with that. A stay wasn't a resolution. It wasn't her license restored or her suspension lifted or Holt's complaint dismissed. It was a pause, a bureaucratic hand pressed against the clock while larger things moved. But it was enough to hold the line. The car moved through Dunmore's morning traffic, and Mara looked out the window at the city she'd chosen to disappear in, at its unremarkable streets and its winter light, and she thought about what Voss had said. Stepping back protects you. And about the specific kind of protection that was on offer there, which was the protection of people who have power over your story, telling you the story comes out better if you're not in it. Her phone buzzed. "Ferris." She answered. "Sloan came to see me," he said. His voice was even but careful. "Warren. About 20 minutes ago. He knows about Marcus." "How?" "He got a call from someone in Okafor's office, junior analyst who didn't know they were supposed to wait." A pause. "He wasn't angry. That's the thing. He sat in the chair by the bed, and he just said, 'Tell me what you know,' and I told him, and he sat there for a while, and then he said, 'I need to make some calls.'" "Is he going to protect Marcus?" Silence on the line. "He's going to do the right thing," Ferris said finally. "He spent 40 years doing the right thing. I think he's going to do it again, even though this is the hardest version of it he's ever faced." Another pause. "I could be wrong. I've been wrong about people before." "I know," she said. "How'd the meeting go?" "Voss is on record. Okafor's moving." "Good." A brief silence. "Valdez, when this is over, let's get it over first," she said. She ended the call. Okafor was watching her from the front seat. Ferris thinks Warren will cooperate, Mara said. Warren's already cooperating, Okafor said. He called me 4 minutes ago. He's coming in this afternoon. The car pulled up to Renner Street. Malsalt. The next 6 hours moved with the specific quality of consequential time. Not fast, not slow, but dense. Each hour carrying more weight than the hours on either side of it. Mara spent most of it in Okafor's second-floor space on Renner, which had transformed from a working space into something that functioned closer to a tactical operations room, with Torres and Reyes coordinating through secure lines and a federal attorney named Delgado who had driven in from Philadelphia, working through the referral documents with the focused intensity of someone who understood that the quality of the paperwork now determined the quality of the outcome later. Warren Sloan came in at 2 in the afternoon. He sat across from Okafor at the folding table, and he gave his statement in the measured, precise manner of a man who had decided what he was going to do and was doing it without hesitation and without theater. He had not known about Marcus's access to the investigation. He had not known about the contact with Voss. He provided, from memory, a chronology of every conversation he'd had with his son over the previous 4 months that was relevant to the case, and when Okafor asked him to sign it, he signed it. He looked older than he'd looked that morning, not by years, by the specific weight of a particular kind of knowledge. Mara watched him from across the room and thought about the different shapes that doing the right thing took and how few of them looked the way people expected. Marcus Sloan was brought in at 4. He came voluntarily. Torres said he'd called before they reached out to him, which told Mara something about what he'd done after she'd left the hotel room. He looked younger than he'd looked that morning, if that was possible. He sat down across from Delgado with his hands flat on the table and said, "I want to cooperate. I want to tell you everything." He did. It took 3 hours and 40 minutes, and it was, by the end, a complete account. How Voss had approached him 18 months ago through an intermediary. How the initial contact had seemed professional and within the scope of his job. How it had shifted incrementally in the way these things shifted until he was passing information that he knew was crossing a line, but had told himself wasn't because the line had moved so gradually that he'd stopped seeing it clearly. How he'd known about Mara's statement within an hour of its completion. How he'd told Voss about Ferris's route. He said that last thing in a flat voice, and then he stopped talking for a moment and the room was quiet. Mara was not in the room for Marcus's statement. She was down the hall, sitting on a folding chair with a cup of coffee that had gone cold, listening through the wall to the faint rhythm of voices without being able to distinguish words. She could tell when the significant parts landed by the quality of the silence that followed them. Torres appeared in the doorway. "Delgado wants your formal statement, full version, on record, with your complete service history attached." She paused. "You ready?" Mara looked at the cold coffee. "Yes," she said. She went in and she gave the statement that she'd been carrying for 3 years, and this time she didn't flatten it or compress it or manage the edges of it. She said what she'd seen, she said what she'd done. She said what the vehicles had looked like and what the blast had done and what those 90 minutes had been like and what she'd found when she reached the third soldier and what the finding had told her in the moment and what it had cost her to hold that and then be told, officially, that the finding was her fault. She said all of it once, clearly, without stopping. When she was done, Delgado looked at her over the top of his reading glasses and said, "The investigation finding against you is going to be formally reopened by the end of the week. I want you to know that." "I know," she said. "Ferris told me." "What Ferris told you and what I'm telling you are different," Delgado said. "He was giving you his assessment. I'm giving you mine, and mine comes with more operational weight." She looked at him. "Thank you," she said, and meant it. Voss was formally served with notification of his status as a named federal subject at 6:17 that evening. Mara knew this because Okafor texted her the timestamp, which was the kind of specific operational courtesy she appreciated. What happened after that was not visible to her directly, but arrived in pieces over the following 2 hours. Halcyon Systems Group's general counsel contacted Delgado's office at 7 to discuss cooperation parameters, which Delgado characterized as an organization that had assessed its exposure and decided that the cost of continued resistance was higher than the cost of an early conversation. Marcus Sloan's federal access was suspended pending review, and his cooperation agreement was formalized in writing. Warren Sloan returned to the hospital, to Ferris's room, and what happened in that conversation was not something Mara knew the details of, but Ferris sent her a message at 8:30 that said only, "He stayed 2 hours. We're okay." She was back in her apartment on Carver Street by 9. She was tired in the specific way that followed sustained high-stakes operation. Not depleted, but emptied out. The particular state where the body knows the acute phase is over and begins the process of accounting for what it spent. She made herself eat something, changed clothes, sat at the kitchen table with the suspension notice still in front of her and read it again, this time with the knowledge of the federal stay request and the reopened investigation and Marcus Sloan's cooperation agreement running underneath the words, changing what they meant. Her phone buzzed at 9:43. Okafor. Holt filed an amendment to his nursing board complaint this evening, Okafor said. He added a provision claiming you accessed a controlled patient file without authorization during your time in the ICU while suspended. Security footage is cited. Mara sat with that. The footage shows me entering Ferris's room. Yes, he's framing it as unauthorized access to a federal patient's protected information. Ferris invited me in. His security cleared me. I know, but Holt doesn't know who Ferris is. He just knows there's a federal presence around that patient, and he's trying to use it. A pause. He's not going to succeed, but he's making this harder than it needs to be, and he's doing it deliberately. What does he get out of it? Mara said. Not a real question. She knew the answer, had known it since the trauma bay. Holt wasn't protecting a system or a principle. He was protecting the version of events in which he hadn't missed a diagnosis that a suspended floor nurse caught in 30 seconds, because that version of events was the version in which he was still the most competent person in the room. His ego is writing checks his career can't cover, Okafor said. Let me worry about Holt. You focus on the building's exterior light, the one that covered the parking area visible from her kitchen window, went out. Mara's attention snapped to the window. The light had not been flickering. There was no wind strong enough to affect a hardwired fixture. It had gone out in the specific way of a deliberate interruption. Sudden, complete. The parking area below going from lit to dark between 1 second and the next. Okafor, she said. I need to call you back. She ended the call before Okafor could respond, moved away from the kitchen window to the wall beside it, and looked down at the parking area from the edge of the glass. 2 cars she recognized. One she didn't. A dark sedan parked at the far end with its engine off, but with the barely visible indicator of an interior that was occupied, the faint shifting of weight that changed how a car sat. She moved through her apartment to the front window, looked down at the street. A second car. Different make. Also occupied. She had chosen this building because it had 2 exits. She went to her closet, pulled the bag she hadn't unpacked since she'd moved in. Go bag, always ready, the habit she'd told herself was paranoia, and now was grateful for, and considered the exits. Front door opened to the main stairwell. Back door opened to the secondary staircase that led out into the narrow alley behind the building, which connected to Brennan Street half a block down. She was already moving when her phone buzzed. Not Okafor this time. Not Ferris. Not a number she recognized. She answered it because the alternative was not knowing. Ms. Valdez. A voice she didn't recognize, older, unhurried, the kind of calm that came from a long career making consequential decisions. My name is Gerald Prine. I work for Halcyon Systems Group, not the general counsel who called Delgado's office this evening. A different part of the organization. The part that turns off parking lot lights, she said. A brief silence. You should know that what happened this evening, Voss's situation, Marcus Sloan's cooperation, the referral, none of that changes the specific problem you represent. Not for the organization as a whole. I'm a floor nurse in Dunmore, Pennsylvania, she said. I don't represent a problem for anyone. You represent the one clean first-person account of what those vehicles looked like before that explosion, he said. Every other documentary element of this case can be contested. Testing records, waiver documents, communication chains. All of it runs through institutional processes where institutional pressure can be applied. But a combat medic's direct observation, given under oath, with her complete service record attached. That's different. He paused. You understand what I'm saying? She did. She also understood that the cars outside were a demonstration, not an execution. If Prine, or whoever Prine represented, had wanted to eliminate her account, they would not have started with a phone call. They were making a calculation about whether she could be moved, and the phone call was part of that calculation. She moved to the secondary stairwell door. I've already given the statement, she said. It's on record. Removing me doesn't remove the record. The record is significantly less useful without you available to testify, Prine said. Then your organization should have thought more carefully about its component testing protocols in 2021, she said, and opened the back door. She heard him begin to respond, and she ended the call and took the secondary stairs at speed. Not running, but fast, the controlled descent of someone who had trained for exactly this kind of exit and whose body remembered it even after 3 years of deliberate civilian life. She hit the alley, turned toward Brennan Street, and was 2 steps into the turn when she saw the third car. This one had its headlights on. It was parked across the alley mouth, blocking the exit to Brennan Street, and the person standing beside it was not a Halcyon operative or a dark-suited intermediary or anyone from the world she'd spent the last 48 hours navigating. It was Clifford Holt. He was standing in this cold in his coat, with his hands in his pockets, and the particular expression of a man who had come to a location deliberately and was prepared for the discomfort of being there. He looked different outside the hospital. Smaller without the white coat, the department, the accumulated weight of 11 years of institutional authority stripped away by February air and an alley behind a dry cleaning shop. But the eyes were the same, that cold, considered fury. Dr. Holt, she said. She stopped, kept the distance between them. I needed to see you, he said, outside the hospital, off the record. This doesn't seem like a conversation I should be having alone in an alley, she said. I'm not here to threaten you. He said it flatly, and she believed it. Not because she trusted him, but because threatening her in an alley didn't align with the kind of threat Holt actually posed, which was institutional and procedural and conducted through channels. I need you to understand something. Go ahead. I have spent 11 years building Harrowfield's trauma program, he said. 11 years of 20-hour days and missed everything and being the person who made the decisions that nobody else would make. Patients who are alive because of how I built that department. He stopped. And you walked in there and diagnosed your patient correctly, she said. He breathed in through his nose. You have no idea what it's like to be responsible for an entire system, to make a call under pressure with incomplete information. I had seconds. So did I, she said, and I was right. The silence that followed was the specific kind that meant something had landed that couldn't be unlanded. The nursing board complaint, she said. The unauthorized access amendment. You know those don't hold. I know, he said quietly. And there it was, small, almost inaudible, but there. Then why? She said. Not angry, genuinely asking. He looked at her. His jaw worked slightly. Because I needed something to be my fault that I chose, he said, instead of a thing I didn't choose. It came out rough, not the polished Holt of Trauma Bay authority, and she thought she understood something about him in that moment that she hadn't understood before, that the performance of certainty, the arrogance that had tried to have her removed from that room, was not actually certainty. It was the specific armor of someone who could not afford to be wrong, and so had spent 11 years making sure no one ever saw him wrong. I'm going to withdraw the nursing board amendment, he said. The emergency provision. That's why I came. She looked at him in the cold alley, at the parking lot light that had gone dark, at the dark sedan at the far end that was still there, which meant Prine's people hadn't moved yet, which meant something about their assessment of the situation that she didn't have time to fully calculate. Dr. Holt, she said, you need to go back to the hospital. I know. And when the review of Tuesday night's trauma response comes, and it's coming, you need to tell the truth about what the ultrasound showed and when it showed it. His jaw tightened. I know that too. All right, she said. He looked at her for another moment. Then he walked back down the alley toward the street, hands back in his pockets, his coat flapping against the wind. Mara pulled out her phone and called Okafor back. "I need a pickup," she said. "Alley behind my building, and I need to tell you about Gerald Prine." "Prine called you?" Okafor's voice sharpened. "He's not supposed to. He's the head of Halcyon's security division. He's completely outside the legal team's mandate." "I know," Mara said. That means the General Counsel's cooperation offer this evening was one hand of the organization, and Prine is the other hand doing something different. A pause. "This isn't over. Voss getting named doesn't stop Halcyon from moving their own pieces." "I know that too," Mara said. She stood in the alley in the February cold, watching the dark parking lot, thinking about cars that don't move and the calculations that keep them still. And she thought about Ferris in the ICU and Warren Sloan signing his statement and Marcus saying, "I want to cooperate," and Holt in the alley saying, "It's why I came." All these people arriving at their versions of honesty through different roads and at different costs, and none of it stopping the car at the alley's end from sitting where it was sitting. Her phone buzzed. Text message. Unknown number. "We know what's in the evidence location Ferris told you about. We've had someone there since this morning." She read it twice. Then she called Ferris. He answered on the first ring, which meant he wasn't asleep, which meant he'd been waiting. "The storage unit on Kellner Industrial Road," she said, "the one with the physical documentation. Is it secure?" A silence that lasted 2 seconds too long. "Ferris," she said. "I sent someone there at noon," he said. His voice was very even. "To check on it. I haven't heard back from them." The cold pressed in from every direction. "How long?" she said. 7 hours, he said. And she heard in those 2 words the thing he hadn't said, which was that 7 hours of silence from someone sent on a 20-minute check meant that something had gone very wrong in a way that probably couldn't be undone, and that the physical evidence, the testing records, the waiver paper trail, the communication chain that turned a document argument into a prosecutable case, was no longer where it had been. Headlights swung into the alley from the Brennan Street end, not Okafor's car. Too fast. Wrong angle. Mara moved. She moved left, toward the wall, because the wall gave her something at her back and reduced the angles, and she did it fast enough that the headlights swept across the space where she'd been standing and not where she was. The car stopped. The door opened and Torres stepped out, and Mara felt her body do the specific thing it did when threat assessment resolved. A release that wasn't quite relief because the situation hadn't changed, just this one vector of it. "We need to move," Torres said. No preamble. "Ferris's evidence location," Mara said. "Kellner Industrial Road." "I know, Okafor's already routing." She was already moving back toward the driver's side. "Get in." Mara got in. The dark sedan at the far end of the parking lot still hadn't moved, which meant Prine's people were watching and calculating. And the calculation they were running now included a federal vehicle in Torres, which changed the arithmetic enough to keep them still for the moment. Moments were what she had, so she used them. Torres pulled out onto Brennan Street and the car was moving before Mara had fully processed sitting down, and the city scrolled past the windows in the specific way it did at night. Lit signs, empty sidewalks, the particular loneliness of a mid-sized American city after 9 in the evening. "What do we know about the storage unit?" Mara said. "Reyes went by at 7 after Ferris flagged it. The unit was locked from the outside, which should mean undisturbed, but the lock was a different make than the one Ferris's contact installed." Torres kept her eyes on the road. "Could be facility management. Could be something else. Ferris sent someone at noon, and they haven't reported back." "I know." A pause. "His contact was a civilian, a researcher named Abby Strand, who'd been helping him organize the documentation. We haven't located her." Mara thought about Abby Strand, whose name she was hearing for the first time, and about what 7 hours of silence from a civilian researcher in proximity to evidence that Halcyon's security division wanted removed actually meant. She didn't say what she thought out loud because saying it didn't help anything. Kellner Industrial Road was on the eastern edge of Dunmore, past the rail yards, in the kind of commercial district that was active during business hours and empty enough at night to make activity visible. Torres killed the headlights 2 blocks out, which told Mara she'd already made her own assessment of the situation. They rolled in on parking lights. The storage facility was a standard single-story complex. Rows of orange roll-up doors under flat overhead lights. A keypad gate at the entrance that was standing open. Open gates on secured facilities at 10 at night meant either a malfunction or someone had wanted it open, and the parking lot light situation at Mara's apartment had demonstrated which version of the world they were operating in. Reyes was already there. He was parked at the far side of the lot, out of the direct light line, and he got out of his car when they pulled up and came over with the specific economy of motion that meant he had information that was bad, but not the worst version of bad. Strand's car is in unit row C, he said. Driver's side door open. Keys on the seat. Strand? Mara said. Found her 20 minutes ago. Storage facility office, back room. She's okay. Locked in, shaken up, not physically harmed. He stopped. They took her access codes and the key to Ferris's unit. She gave them up after... She said there were 2 of them and they had zip ties, and she's a 42-year-old research archivist, so... She did what she had to do, Mara said. Unit's open, he said. Whatever was inside, it's not anymore. The 3 of them stood in the parking lot and let that land. Mara thought about the physical documentation Ferris had described. Testing records, waiver paper trail, communication chain. The difference between a case built on testimony and digital evidence and a case that also had original physical documents was the difference between arguable and inarguable, and Prine's people had clearly understood that and acted on it with a precision that meant they'd had the location for longer than the text message suggested. How did they get the location? She said. Reyes and Torres exchanged a glance that she caught. That's what Okafor's working on, Reyes said. Marcus Sloane's cooperation statement, she said. Did Ferris tell Marcus about the storage unit? We don't know yet what Marcus had access to through the investigation file, Torres said. The storage unit location may have been in Ferris's activity reports, which meant Marcus might not have intentionally given it up, which meant it might have been in a document that Halcyon accessed through whatever channel Marcus had opened, and Marcus might not have known the specific consequences of the access he'd enabled, which didn't change the outcome, but changed the shape of the accountability. She went and talked to Abby Strand. Strand was sitting in the storage facility's small office with a cup of coffee that the night manager had produced, and her hands wrapped around it with the tight grip of someone managing residual adrenaline. She was compact and precise-looking, the kind of person who organized things for a living and had the specific disorder of someone who had been made suddenly, violently aware that the world did not always respect organization. They knew what they were looking for, Strand said. Her voice was steady, which Mara noted approvingly. They went straight to the unit number. They didn't look around or hesitate. They had a list. Did they say anything? One of them said, while they were loading the boxes, he said to the other one, "Tell Prine it's clean." She looked at Mara. I don't know who Prine is. Mara knew who Prine was. You did the right thing, Mara told her. You're alive and unharmed, and that is the correct outcome of what happened tonight. She meant it. The research archivist in the back room of a storage facility was not a combatant and had not been asked to become one. And the decision to give up access codes rather than test the intentions of 2 men with zip ties was not a failure of anything. The documents, Strand said. Commander Ferris, he spent months collecting those. If they're gone, tell me about the documents, Mara said. Specifically, what were you archiving? Strand looked at her for a moment with the assessing expression of someone deciding how much context to apply to a stranger. Then she made a decision. Original procurement correspondence between Voss's office and Halcyon's contract manager. Printed copies of the internal test failure reports with original signatures. The waiver application chain. She paused. And a set of internal emails from Halcyon's engineering division that were given to Commander Ferris by a source inside the company 14 months ago. Those were the most significant piece. They showed that the engineers flagged the lower hull junction failure to management and were told to resubmit the test with adjusted load parameters. Mara was very still. Adjusted to pass. Yes. Are there copies of any of it? Strand's expression shifted. Just slightly, just enough. The physical originals are what they took, but I scan everything as part of my archiving process. She paused. The digital copies are on a drive I keep at my apartment, not connected to any network, air-gapped. The office was quiet except for the fluorescent light hum. Strand, Mara said carefully, have you told anyone else that you scan everything? I mentioned my process to Commander Ferris. I don't think I mentioned it to anyone else directly. Does that drive have your home address associated with it anywhere? Strand went very still. Then she stood up. I need to call my husband, she said. He's home. Mara was already on her phone to Torres before Strand finished the sentence. Dear. Reyes got to Strand's apartment 12 minutes ahead of anyone else, which turned out to be 8 minutes ahead of a second Halcyon team that had been moving on the same information through a different route, and the 8 minutes were enough. The drive left with Reyes and Strand's husband left with a neighbor, and the apartment was empty when the second team arrived, which Reyes later described as the cleanest version of an outcome he'd expected to be significantly worse. The drive reached Okafor at 11:41. Mara was present when Okafor plugged it in and the files opened, and she was present for the moment when the engineering emails loaded on screen, the thread between Halcyon's lead structural engineer and the VP of manufacturing, dated 6 weeks before the fielding of the vehicles, in which the engineer wrote with the specific desperation of someone who has said something multiple times and is saying it one more time because they have run out of other options. I cannot sign off on revised parameters. The lower hull junction will fail under operational load. This is not a testing methodology question. This is a structural failure waiting to happen in the field. The VP's response was 3 sentences. One of them was, the contract closes Friday. Resubmit with the adjusted figures. Mara read the thread twice and then looked away from the screen because the specific anger she was feeling was not useful in the room she was in, and she had learned a long time ago how to put useful distance between herself and what she felt about true things. Delgado was called back from wherever he'd been at midnight. He arrived looking like a man who had been asleep for 2 hours and had the professional capacity to set that aside when required, which he did efficiently. He reviewed the drive contents with the focused attention of someone building a structure in real time, making notes that were only legible to him, and occasionally asking Okafor questions in the shorthand of people who had worked together long enough to have developed a compression of language. At 12:45, he looked up. This is sufficient, he said. This plus Strand's testimony about the archive, plus what we already had from Marcus Sloane's cooperation statement. This is a prosecutable case. The physical originals being taken doesn't gut it. It actually adds an obstruction element that makes certain aspects of it cleaner. How soon? Okafor said. Voss is served. Marcus is cooperating. Prine is an active escalation I need to brief my supervisor on before we move on him specifically, but Halcyon is an entity and Voss individually. We can move formally within 48 hours. He looked at Mara across the room. Your testimony is the anchor. You understand that? Every document in this case is argued by attorneys. Your account of what those vehicles looked like from 10 feet away, what the blast propagation told you about structural failure, that's what makes this real to a jury. I understand, she said. The nursing board hearing is scheduled for 9 days from now, he said. We'll have the federal stay formally in place by tomorrow afternoon. The board can't proceed while you're a material witness in an active federal investigation. And after the investigation resolves, she said, after it resolves, you walk into that hearing with a fully cleared military record and the testimony of a special operations commander whose life you saved in a documented medical emergency. He looked at her over his reading glasses. Holt's complaint is going to have a hard time surviving that environment. She thought about Holt in the alley, about the specific exhaustion in his face that had not been performance, about its why I came and the nursing board amendment he'd said he would withdraw. He's going to withdraw the amendment himself, she said. Maybe more of it. Delgado looked skeptical. What makes you say that? Because he came to find me tonight and he didn't have to. She paused. He's not a good person exactly, but he's not the worst kind of bad one either. He's the kind that makes terrible decisions for comprehensible reasons and then has to live in the house those decisions built. Delgado absorbed that without comment. Then he closed his notebook and said to Okafor, "I need 3 hours of sleep and a working printer in the morning. Is either of those available?" "One of them," Okafor said. Mara went back to her apartment at 2 in the morning and sat on her bed in the dark for a while without doing anything particular. The parking lot light was still out. The street below was empty. She sat with the specific quality of a situation that had moved past the acute phase and into something longer and less legible. The ongoing work of a thing that wasn't over but had changed what kind of thing it was. She thought about 3 soldiers, about the lower hull junction, about an engineer who had said this is a structural failure waiting to happen in the field and been told to resubmit with adjusted figures. She thought about the 6 weeks between that email and the deployment, 6 weeks in which someone could have stopped it. Multiple someones, at multiple points, each one with a reason that probably felt sufficient at the time. Career risk, contract timelines, the specific bureaucratic weight of going against a decision that had already been made by people with more authority than you. 6 weeks of accumulated small choices that added up to 3 soldiers in a vehicle that was waiting to fail. She was not going to resolve that tonight. She was not going to resolve it in a federal courtroom, or in a nursing board hearing, or in anything that happened in the next 48 hours. The resolution of a thing like that, she had learned, was not a single event. It was a direction you kept moving in after you'd been moving in the wrong one for too long. She lay down without changing clothes, and she slept for 5 hours, which was more than she'd expected. The next 3 days moved with the grinding forward momentum of institutional process accelerating, which was not the same as moving fast, but was different from the previous 3 years of institutional process moving not at all in her direction. Delgado's 48-hour timeline stretched to 72 because the briefing chain for Prine required a level of authorization that involved 3 people who were in different time zones, but the filing on Voss moved on schedule, and the Halcyon General Council's cooperation conversations intensified in the way that happened when an organization assessed that the cost of holding the line had exceeded the cost of managed disclosure. Prine went quiet. The cars outside her building didn't return. Whether that was because Prine had been told to stand down or because the calculation about what she represented had shifted, she was already on record, the digital evidence was in federal custody, removing her achieved less than it had 2 days ago. She didn't know, and in the absence of knowing, she treated the quiet as operational information and kept her exits in mind regardless. Ferris was discharged from Harrowfield on the 4th day. He walked out under his own power with Torres flanking him and his 2 people at the perimeter and Mara watching from the lobby because Okafor had asked her to be available at the hospital for a document signing that morning, and she'd been in the building when he came through. He stopped when he saw her. "You look like you haven't slept," he said. "I've slept," she said. "I look like this normally." Something in his face did the thing she'd noticed before. That careful movement between professional regard and something more specific. "Strand's Drive," he said. "Okafor told me about the emails. The engineering thread." "Yeah." He was quiet for a moment. "I'd had that for 14 months. I kept thinking it would feel like something. Finding it, I mean. Like it would resolve something." He paused. "It just makes me angry." "It should," she said. He looked at her. "The nursing board hearing, 9 days. 7 now. Warren's agreed to submit a written statement to the board, attesting to your actions in the trauma bay and the federal context of the complaint against you." He said it without making it a bigger thing than it was, which she appreciated. He wanted to do more. I told him the statement was enough. "It's enough," she agreed. He nodded. Then he shifted his weight in the way of someone who has something else to say and is working out whether to say it. "I'm going to be in Dunmore through the Voss proceedings, however long that takes. I'd like—" He stopped, tried again. "I'd like to buy you dinner sometime. Not as a debrief, just as a thing." She looked at him, at the situation, the complexity of it, the ways in which he was tangled up in every significant event of the last week of her life, the ways in which that was both disqualifying and irrelevant. She was 30 years old, and she had spent 3 years being careful in a way that cost her things she hadn't fully accounted for. "When the hearing is done," she said. "When the hearing is done," he agreed. He walked out. Torres went with him. The lobby returned to its ordinary hospital morning. The nursing board hearing convened on a Thursday at 9 in the morning in a fourth-floor conference room at the Pennsylvania State Nursing Board's regional office, which had the specific institutional atmosphere of a room designed for important proceedings that nonetheless looked like any other conference room. Long table, chairs, a window with Venetian blinds that let in light at an angle that put Mara's side of the table in mild shadow. She had a lawyer. His name was Perry Osei, and Delgado had recommended him, which meant he was the kind of attorney who worked in the intersection of federal case activity and professional licensing and knew how to speak both languages. He was unhurried in the way of someone who had assessed the situation and found it favorable and was prepared to let the proceedings demonstrate that without theatrical assistance. Holt was present. He sat on the opposite side of the table with the hospital's legal representative and the expression of a man who had made several decisions in the past week that he was in the process of living with. He had, as he'd said in the alley, withdrawn the unauthorized access amendment. He had not withdrawn the core complaint, but the core complaint had also not escalated further, which was its own form of information. The board chair was a woman named Renata Cross, who had been in nursing administration for longer than Mara had been alive, and had the specific economy of motion that came from having run this kind of proceeding many times and knowing exactly what mattered and what was noise. She opened by acknowledging the federal stay request and its resolution. The stay had been in place. The investigation had reached a procedural point where the board could convene without compromising material witness availability. And then she said, with the particular precision of someone who had read everything submitted, "We have received a significant volume of documentation in this matter beyond the original complaint. I want to be clear about our process. We are not here to adjudicate the federal investigation. We are here to assess whether Ms. Valdez's clinical conduct on the night in question met the standard of care appropriate to her licensure and professional role." Holt's attorney leaned forward. "The complaint specifically addresses Ms. Valdez's unauthorized assumption of diagnostic authority." "I've read the complaint," Cross said, without sharpness, just fact. "We'll get to it." The next 2 hours were a careful, methodical examination of Tuesday night's trauma response. The board had the trauma bay documentation, the attending's notes, the resident's notes, the monitoring record, the post-procedure assessment of Commander Ferris's condition, and the ultrasound images that had been automatically archived by the machine Mara had used. What the ultrasound images showed was unambiguous. What the monitoring record showed, the oxygen saturation trajectory, the blood pressure collapse, the stabilization immediately following pericardiocentesis, was unambiguous. What the resident's notes showed, written in the careful language of a trainee who understood that he was documenting something with implications he couldn't fully predict, was unambiguous. Holt's attorney argued procedural breach. Mara's attorney responded with clinical outcome. The board listened to both and cross-asked questions that were specific and pointed and did not leave room for the kind of ambient uncertainty that arguments built on procedure tried to create. At 11:15, Warren Sloan's written statement was entered into the record. It described the specific events in the trauma bay as they had been documented, added the federal context in appropriate terms, and included a single paragraph that Mara had not known was there until Osei read it into the record. The conduct of Ms. Valdez in the trauma bay on the night of the 3rd represents the kind of clinical decision-making that saves lives when institutional process fails to. This board would be poorly served by allowing a professional complaint filed in the absence of that context to stand. Cross read it twice, made a note. At 11:40, Clifford Holt spoke. He had not been scheduled to speak beyond the initial complaint presentation. He asked Cross for the floor, and Cross looked at him for a moment and then granted it, which meant she'd assessed that what he was about to say was worth hearing. He stood. He was not the version of Holt from the trauma bay, not the performance of absolute authority, not the cold management of anyone who might complicate his picture of events. He was a man of 53 who had spent 11 years being the loudest voice in every room and had recently had occasion to sit with what that cost. "The complaint I filed was accurate in its description of events," he said. "Ms. Valdez did perform an assessment and operate equipment without direct physician order. That is a procedural fact." He paused. What the complaint did not accurately represent was the clinical situation those actions occurred in response to. and why I characterized them as I did. He stopped again. The room was very quiet. I missed the diagnosis. Ms. Valdez identified it correctly. The patient survived because of what she did and not because of what I did. And I filed the complaint in part because the alternative was acknowledging that in a documented, formal way, and I found that difficult. He said the last part without inflection, which was harder than saying it with inflection. I should not have filed it. I'm withdrawing it in full. He sat down. The room stayed quiet for a moment that had a specific quality to it. Not dramatic, but real. Cross made another note. Then she said, "Thank you, Dr. Holt." And she meant it in the way of someone who understood what that had cost and did not undervalue it. The board convened a brief closed session. It lasted 22 minutes. When Cross returned, she stated, with the directness of someone who had no interest in extending a proceeding that had reached its conclusion, that the complaint against Mara Valdez was dismissed in full, that no finding of professional misconduct would be entered, and that Ms. Valdez's nursing license remained in good standing without condition. She said this to the room. She also said it directly to Mara, with the particular directness of one professional addressing another across a table. "You made the right call," Cross said. "Under conditions that weren't designed to make that easy." Mara held her gaze. "Thank you." She did not cry in the conference room because she was not someone who cried in conference rooms as a general rule, and also because what she felt in that moment was not the kind of emotion that came out as tears. It was something older and more structural, a weight she'd been carrying for long enough that she'd stopped feeling its specific shape, and the gradual, undramatic sense of it shifting. Osei shook her hand in the hallway. He was pleased in the way of someone who had expected this outcome and was nonetheless genuinely glad to have arrived at it. She thanked him, and he went to return his parking validation, and she stood in the corridor outside the hearing room for a moment by herself. Her phone buzzed. "Okafor," she answered. "Voss accepted a negotiated plea this morning," Okafor said, and her voice had a different quality than it had carried for the last week. Not relaxed, but arrived at something. "It came through an hour ago. Guilty to 1 count of federal procurement fraud and 1 count of obstruction. The cooperation agreement requires full disclosure on the Halcyon authorization chain." Mara stood in the corridor with the Venetian blind light coming through a window at the end of it and the sound of the building's ventilation system running its ordinary business. "And Prine," she said, "arrested this morning, his team from the storage facility, the 2 who took Strand, were picked up overnight. Prine himself at 6:45. Obstruction, witness intimidation, conspiracy." A pause. Halcyon's board placed the CEO on administrative leave pending internal review. 3 executive-level departures in the last 48 hours. The company is cooperating. Marcus Sloan? His cooperation agreement is holding. He'll face professional consequences. The DAO access is permanently revoked, and there will be an administrative proceeding about the access violations. Criminal exposure is significantly reduced by his early cooperation. He's going to have to rebuild something, but he'll have the opportunity to. She thought about Marcus in the hotel room, about "I want to cooperate," about the particular shape of a man who'd made a serious mistake and then decided at the first real moment of decision to stop making it. "Warren," she said. "He testified this morning. In person, voluntarily, full cooperation." A pause that was longer than Okafor's usual pauses. He's going to be okay, I think. It's going to be hard for a while." Mara thought about a man sitting in a chair by a hospital bed saying, "Tell me what you know," to someone who was about to tell him something he could never unknow. "The military investigation findings," she said. "My deployment record." Formally reopened as of yesterday. The IG referral includes a specific mandate to review the original investigation findings in light of the Halcyon documentation. It won't be fast. These things move on their own timeline, but it's moving. Okafor's voice had something in it that was not exactly warmth, but was adjacent to it. For what it's worth, Delgado's formal assessment to the review board characterized the original finding against you as procedurally flawed and evidentiary deficient. That's in writing in the federal file. Mara stood with all of that, with the weight of it. "Thank you," she said, "for the last week. You did the work. Okafor said. I just didn't make it harder than it needed to be. A pause. That's more than some people get. She ended the call. She stood in the corridor for another moment. Then she put her phone in her pocket and walked toward the elevator, and the conference room was behind her, and the morning was ahead of her, and the hearing that had been scheduled to end her career had ended with the complaint dismissed and the record intact, and Clifford Holt saying, I should not have filed it in a room full of professional witnesses. She was in the elevator when Ferris texted. A single line. Heard from Okafor. Tell me how you're doing. She looked at the text for a moment. She typed back, 7 days. Dinner. His response came before the elevator reached the lobby. 7 days. She put the phone in her pocket. The elevator opened onto the lobby, which was ordinary and fluorescent and populated by the ordinary morning business of a building full of people working through their own complicated situations, and she walked through it and out the front door into February air that was cold but dry, the kind of cold that clarified rather than pressed, and she stood on the steps for a moment before moving because the step from inside to outside felt like the kind of threshold worth acknowledging even if only to herself. Her phone buzzed again. She expected Ferris, or Okafor, or Osei with something procedural. It was a number she didn't recognize, not the Voss number from before, not Prine, a different pattern. She answered. Ms. Valdez, a woman's voice, older, precise, with the specific authority of someone who did not often make calls herself and was therefore not accustomed to being the one waiting. My name is General Adayeze Mora. I'm the commanding general of the Army Medical Command. A pause. I've been briefed on the IG referral and the Halcyon matter and on your service record. Another pause, shorter. I'd like to meet with you, in person, at your convenience, which I would prefer to be soon. Mara was standing on the steps of the nursing board regional office with the February cold working its way through her coat, and she was being called by the commanding general of the Army Medical Command, and she thought she understood what the call was, but she also understood that until she heard it in person, she wouldn't know its full shape or what it was going to ask of her. I'm available, she said. Good, the general said, and in her voice, underneath the precision, was something that sounded very much like, we owe you something and we know it, and I intend to be the one who says it to your face. When? Mara said. The general told her, and Mara stood on the steps with the number written in her memory and the cold around her and the hearing behind her and 3 names she'd been carrying for 3 years. And for the first time since she'd left the army, she felt the particular sensation of a door she'd thought was permanently closed, opening from the other side. The meeting with General Moran was set for the following Monday in Philadelphia, which gave Mara 6 days that she used in the way she used time when a situation had shifted from acute to consequential, methodically, without rushing, doing the things that needed doing and not inventing urgency where none existed. She went back to her apartment on Carver Street and she looked at it, at the minimal furniture and the go-bag in the closet and the nothing on the walls and the deliberate impermanence of a space she'd designed to be left. She had lived like someone paused mid-sentence for 3 years, and the habit of it had become so ingrained she'd stopped noticing it was a habit. She noticed it now. She didn't redecorate. She wasn't that person. But she unpacked 3 boxes she'd never opened since moving in, books mostly, and a framed photograph she'd carried through 4 deployments and 3 apartments, and had never put on a wall because putting it on a wall meant admitting she was somewhere long enough to matter. She put it on the wall above the kitchen table. 3 people in desert gear squinting into flat white light, one of them much younger and not yet carrying the things she'd later carry. She looked at it for a while. Then she made coffee and sat beneath it and felt the specific quality of a thing being put back where it belonged. Okafor called on Friday. The Halcyon CEO, a man named Gerald Fitch, who had been insulated from direct procurement decisions by enough organizational layers that his criminal exposure was limited but real, had reached his own cooperation agreement. The entire executive chain between Fitch and the engineering team that had flagged the lower hull junction failure was now on the record. The story from the internal emails was confirmed and expanded. 4 people had known the component would fail under operational load. 2 of them had argued against fielding the vehicles. Both had been overruled by the contract timeline. Both were cooperating. Prine had not cooperated. He was facing the full weight of the obstruction and conspiracy charges without a cooperation agreement, and Delgado characterized his posture as that of a man who believed institutional loyalty would be rewarded, which Delgado said with the particular dry quality of someone who had watched that belief not get rewarded many times over a long career. Voss's plea agreement required him to testify against Prine at trial. He would do it, his attorneys had confirmed. He would stand in a federal courtroom and describe the specific decisions he'd made, and the specific conversations he'd had, and the specific knowledge he'd possessed. And he would do it under oath in front of a judge. And whatever the sentencing outcome was for him personally, the public record would contain his name attached to what he'd done in a way that couldn't be expunged or reclassified or filed somewhere dark. That mattered. Not as much as 3 soldiers, but it mattered. She found herself thinking about the halcyon engineer. The one who'd written this is a structural failure waiting to happen in the field and been told to resubmit with adjusted figures. She asked Okafor about him. His name was Robert Garza. He was 51 years old, and he had left Halcyon 8 months after the vehicles were fielded and the soldiers died, having told his supervisor in his exit interview that he was pursuing other opportunities. He had not spoken publicly. He had not filed a complaint. He had carried what he knew in the specific way that people carry things they told someone about and were ignored. Okafor had already been in contact with him. He had agreed to cooperate. He had cried on the phone, Okafor said, which she mentioned not as a detail but as context. The kind of thing that told you something about the shape of 4 years of carrying something alone. Mara thought about that for a long time. So, she drove to Philadelphia on Sunday evening and stayed in a hotel that was functional and quiet and entirely unlike the Braddock, which she appreciated. She slept well, which surprised her slightly, and then didn't. The Army Medical Command's Regional Administrative Office was in a federal building downtown, and General Adeas Morin's space within it had the specific character of a senior officer's workspace, organized, spare, with exactly the right number of framed items on the walls to communicate history without demanding attention. Morin herself was 62, tall, with the particular economy of movement that decades of command produced, and she looked at Mara when she came in with the direct attention of someone who had read a file thoroughly and was now reconciling it with the person. "Sit," she said, and poured 2 cups of coffee from a carafe on the credenza without asking, which told Mara something about the kind of meeting this was going to be. She sat. She took the coffee. "I'm going to be direct," Morin said, taking her own seat. "The IG referral has triggered a formal review of your 2021 deployment investigation findings. That review is going to reach the conclusion it's going to reach, and I have good confidence about what that conclusion will be. But it's a process, and processes take time. What I can tell you today is not the formal outcome. I can't give you that yet. What I can tell you is my assessment, as the person who will ultimately receive that review's recommendation." Mara held the coffee cup and waited. "You were assigned culpability for 3 deaths that resulted from a procurement failure that predated your deployment by 6 weeks. The investigation that produced that finding was conducted with incomplete evidence, some of which was missing because it had been removed, and proceeded to a conclusion that was both procedurally inadequate and factually wrong." Morin said it without softening or dramatizing it, one precise sentence after another. "You should never have been found responsible. The finding should not be in your record. It will not remain in your record." Mara had known this was coming. She had known it intellectually since the engineering emails, since Voss's plea, since the shape of the case had become clear. Knowing something intellectually and hearing it said out loud by a general officer in a federal office with coffee on the table between you were different experiences, and she sat with the difference for a moment. "How long for the formal review?" she said. 6 to 8 weeks, possibly 10. These things don't always cooperate with timelines." Morin looked at her steadily. "But I want to be clear. The outcome is not uncertain. The question is only when the paperwork catches up to the truth." She paused. "I owe you that clarity, and the Army owes you more than that. I'm aware of the gap." "You're acknowledging it," Mara said. "That's not nothing." Something in Maureen's expression moved. Not sentimentality. She wasn't that kind of officer. But something genuine. "No," she said. "It's not nothing, but it's also not enough. And I don't intend to pretend it is." She set her cup down. I want to talk to you about something else. About what comes next for you, if you're open to that conversation. Mara looked at her. I'm open to it. Your full service record, the real one, once the investigation finding is cleared, represents one of the more complete skill sets the Army Medical Command has encountered in a combat medic. 4 deployments, multiple documented life-saving interventions under active fire conditions, formal field surgery proficiency, and a nursing licensure on top of that. Morin was matter-of-fact about it, not performing admiration. We have a gap in our medical training pipeline at the Special Operations Support level, a significant one. I'm not recruiting you back into active service. I don't think that's what you want, and I don't think it serves either of us. What I'm interested in is whether you'd consider a consulting role, specifically around field trauma protocol development and medical training for Special Operations Support teams. Mara was quiet for a moment. That's not a small thing to offer. No, Morin agreed. It's not. Why me specifically? You have people in the pipeline. I have people who trained in classrooms and simulations and did 1 or 2 deployments under controlled conditions. You have people who did 4 deployments in environments where the gap between what the textbook says and what the field requires was visible every day. Maureen looked at her without qualification. The thing you did in that trauma bay last week, recognizing a tamponade presentation in under 60 seconds from a corner of the room while the attending was treating the wrong thing, that's not a classroom skill. That's the kind of pattern recognition that only comes from the specific experience you have. She paused. I want that in our training pipeline, not locked away in a hospital corridor in Dunmore. Mara thought about the protocol, about the specific frustration of watching Holt treat a pneumothorax while the real problem was visible in the neck veins and the tracheal deviation and the pattern of a blast injury she'd seen before, about the hours she'd spent in field conditions developing the kind of rapid differential that no simulation fully reproduced. I'd need to understand the scope, she said, the time commitment, how it interfaces with, I have a nursing position to sort out. Of course, Morin allowed a brief pause. Speaking of which, I've been informed that Harrowfield Medical Center's administration reached out to your legal representative this week. Mara's eyes sharpened slightly. What kind of reach out? The formal kind. They want you back. Marin's expression had something in it that was not quite a smile but occupied the same territory. The department director, not Holt, the person above Holt, made a direct inquiry about the conditions under which you might be willing to return to the trauma team. Mara sat with that, with the specific reversal of it, with what it meant that the institution that had deactivated her badge and processed her suspension and conveyed Holt's complaint had made a direct inquiry about the conditions under which she might return. Not Holt, she said. Not Holt, Morin confirmed. From what I understand, Dr. Holt is in a separate process with his department regarding his conduct and the complaint he filed. Mara thought about Holt in the alley, about I should not have filed it in a room full of witnesses, about the specific cost of that, which was real, and the specific limits of what cost alone accomplished. What kind of separate process? She said. The hospital received the nursing board hearing transcript, Morin said. His withdrawal of the complaint in that setting, on the record, and the characterization of his original filing. The board's own summary characterizes it as a complaint filed in the context of a professional conflict of interest. She paused. My understanding is that the hospital's Department of Clinical Standards has opened a performance review of Dr. Holt's conduct in the trauma bay and subsequent actions. The outcome of that review will determine what happens to his leadership role. He'll fight it, Mara said. Probably. People like that usually do. Morin looked at her. But he withdrew the complaint himself, on the record, with a room full of witnesses. He made that choice, and it's in the transcript, and there's very little an attorney can do with a client who told the truth in a formal proceeding. She wasn't wrong. Sick. Mara drove back to Dunmore on Monday evening with the windows down despite the cold because she needed the air to think, and she thought for 2.5 hours without arriving at anything. She could call a decision, which was fine because she didn't need to decide yet, and she'd learned enough about the cost of deciding before you were ready to not do it out of impatience. Ferris was already in the city. He'd taken a short-term rental near the federal courthouse while the Voss proceedings moved through their early stages, and she'd known he was there and had maintained the 7-day agreement with the slightly formal quality of two people honoring a word they'd given, which she found she appreciated about him. 7 days landed on a Tuesday. He picked a restaurant without consulting her, which she noted, and it was a specific kind of choice, not expensive, not performative, a neighborhood place on Calder Street with good light, and a menu that took its food seriously without asking you to perform appreciation of it. She got there first, which was also a choice, and she was looking at the menu when he came in, and she looked up and he had that expression she'd cataloged in the ICU, the one between professional regard and something more specific. And she thought, all right, this is a thing that's happening. They talked for 3 hours. Not about Voss, not about Prine, not about the engineering emails or the IG referral or the Army Medical Command. They talked about the things people talk about when they are learning the ordinary shape of someone they've only known in extraordinary circumstances. Where he'd grown up, which was eastern Tennessee, a small city with a river through the middle of it. What she'd wanted to be before the Army, which was a translator, because she'd been good at languages and had not yet understood that she was also very good at the specific skill set that would eventually occupy her life. He told her about a hiking trail in a national park in New Mexico that he'd done twice and wanted to do again. And she told him about a cafe in a city in a country that she'd been to on a mission and whose real name she still didn't use because old habits, but where she'd had the best coffee of her life. He was not uncomplicated. That was clear within the first hour and confirmed by the third. He had the specific damage that came from a career spent in high-stakes situations, the hypervigilance that never fully turned off, the difficulty with civilian scale where problems were real but differently weighted, the habit of reading rooms. She recognized these things because she had them too, and there was something clarifying about being in the company of someone who did not require explanation for why you sat with your back to the wall. When the restaurant closed around them without their noticing, they moved the conversation outside, standing on Calder Street in air that had warmed slightly from the previous week, and he said, I'm going to be in Dunmore for at least 3 more months, probably more. I know, she said, and after that's unclear. I know that too. He looked at her. I'm not good at the unclear part. Neither am I, she said, but I'm better at it than I used to be. He walked her to her car. He did not kiss her, which was either restraint or the same careful quality she had herself, and she thought about that on the drive home in a way that was not frustrated, but was interested. 6 weeks later, the formal review conclusion arrived. It came in writing, as these things do, a letter from the Army's Judge Advocate General's office, addressed to her full legal name, which she still sometimes startled slightly at seeing in formal correspondence because she'd been Valdez for so long. The letter was 4 pages. The first 3 pages were the procedural account, the review process, the evidence examined, the conclusions reached. The 4th page was a single paragraph that she read 3 times standing in the entry of her apartment. The 2021 investigation finding against specialist Mara Valdez was formally vacated. The finding had been reached under evidentiary conditions later determined to be materially incomplete. No basis for the original finding remained in the record. Specialist Valdez's service record was corrected to reflect this determination, and her full military record, the real one, all of it, the decorations and the commendations and the specific combat actions that had never been in the file she'd been allowed to access for the last 3 years, was restored and made complete. She stood in her entry hall and held the letter and did not cry exactly, but came close enough that the distinction felt more technical than real. She called Ferris first, which told her something about the last 6 weeks. He answered on the 2nd ring, and when she told him what the letter said, he was quiet for a moment, and then he said, "Read me the last paragraph." She did. He was quiet again. Then, "Good," he said, and the word was very small and very full. She called Okafor second. Okafor said, "I'll get it filed with Delgado's office today," in the efficient voice that was her version of celebration, which Mara had learned to read correctly. She called her mother third, which was a phone call she'd been making less often than she should, and more often in the last 2 months than in the previous 3 years. And her mother's voice when she answered had the specific quality of a woman who had waited a long time for something and was trying not to let the waiting show. Mara told her what the letter said. Her mother said, "I always knew." She said it not as accusation, but as fact, the bedrock certainty of someone who had held a truth in the absence of documentation for years. "I know you did," Mara said. Matu. The Halcyon trial for Prine began 8 weeks after that and ran for 11 days. Mara testified on the 4th day. She sat in the witness chair in a federal courtroom in Philadelphia, and she told what she'd seen, what she'd done, what the vehicles had looked like, what those 90 minutes had cost. She used precise language, and she did not perform emotion, and she answered the cross-examination questions without hostility or elaboration, just the facts, laid out in the specific order in which they'd occurred, with the clinical exactness of a person who had been trained to observe and document and who had never actually forgotten a detail of what she'd observed. Robert Garza testified on the 6th day. He was a compact man with the specific wear of someone who had carried something heavy for 4 years, and he described the internal email chain and the resubmission order and the 6 weeks and what he'd known and what he'd said and what had happened after he'd said it. He did not cry on the stand. He had, Okafor had said, cried on the phone. In the courtroom, he was precise and steady and exhausted in the particular way of someone reaching the end of a long journey they'd thought would never end. Voss testified on the 8th day. He had aged visibly since the hotel room, not from time, which had not passed in sufficient quantities to explain it, but from the specific wearing effect of a decision he'd made to cooperate and then had to live inside as it became real. He answered the prosecution's questions, and he answered the defense's cross-examination, and he confirmed the facts that the emails and the documents and the testimony of Garza and Valdez had already established. And when he was done, he walked out of the courtroom with his attorney, and he did not look at Mara, which was a choice she registered and did not pursue. The jury deliberated for 4 days. Prine was convicted on all counts: obstruction of justice, witness intimidation, conspiracy to destroy federal evidence. The sentences were announced 3 weeks later in a brief hearing that Mara attended by choice, sitting in the public gallery, because she had decided that the public gallery was where she wanted to be when the formal record closed on what had been done. Gerald Prine received 6 years in federal prison. The 2 operatives who had locked Abby Strand in the storage facility office and taken the boxes received 4 years each. Halcyon Systems Group paid a federal penalty that Delgado described as significant in the context of defense contractor accountability proceedings, which meant it was not the largest penalty ever levied, but was real enough to matter to the people whose careers had been built on that contract. The CEO, Fitch, received a suspended sentence under the cooperation agreement and a permanent bar from federal contracting. 3 executive-level employees received criminal charges and various outcomes. 2 of them negotiated reduced sentences, and 1 went to trial and lost. Alan Voss, under the terms of his plea agreement, received 2 years of supervised release and a permanent bar from federal service and federal contracting. He would not go to prison. Mara had known this was the likely outcome of the plea structure from early on, and she had made her peace with it in the way she made peace with things she couldn't control, not by becoming indifferent, but by not letting the parts she couldn't control overshadow the parts that were real. What was real? The formal record, the vacated finding, the engineering emails, entered as exhibits, permanently part of the public court record of a federal trial, the guilty verdict on Prine, the public corporate penalty on Halcyon, the testimony of 4 people in a federal courtroom about what had happened and who had made it happen. 3 soldiers had names that were now part of a federal proceeding, on record, in a courthouse, in the kind of document that didn't get filed somewhere dark. That was not the same as them being alive, but it was something that pointed in the direction of truth, and she had come to believe, through the work of the last few months, that pointing in the direction of truth was most of what accountability actually looked like in the real world, as opposed to the version where consequences were clean and outcomes were proportional and justice arrived in a form you'd recognize from the outside. The real world didn't work that cleanly. She'd known that for a long time. The question was what you did with the gap between the world's actual justice and the justice you'd needed. And her answer to that question had been, for 3 years, to disappear. To make herself small enough that the gap didn't have to be answered. She understood now that she'd been wrong about that. Not wrong to survive it the way she'd survived it. She'd done what she could do with what she had, but wrong about what the disappearing protected her from, which turned out to be mostly herself. The consulting arrangement with General Moran's office was formalized in March. It was a 12-month initial term, renewable, structured around quarterly intensive training engagements with special operations medical support teams, protocol review and development, and, at Moran's specific request, a field trauma assessment manual that Mara was charged with developing from scratch, drawing on her deployment experience to document the gap between clinical training and field reality in a way that could be institutionalized. She didn't stop nursing. That wasn't the arrangement, and it wasn't what she wanted. She returned to Harrowfield on a formal basis 2 weeks after the nursing board hearing, not to the trauma team initially, but to a senior clinical educator role that the department director had proposed, and that Mara had looked at carefully and decided was genuinely useful and not a consolation. She was in the trauma bay on a regular basis. She was not Holt's subordinate. Holt was no longer the trauma team director. The clinical standards review had concluded in February. Its findings were not published publicly. Personnel matters at that level rarely were. But the outcome was a matter of professional record within the department. Holt's leadership authority over the trauma team was removed. He retained his surgical privileges and his medical license. The review had found misconduct in his conduct toward Mara, but had not found the kind of clinical negligence that would have justified license action. He was still at Harrowfield, still operating, still present in the building. He and Mara crossed paths occasionally in the corridors, and they exchanged the professional acknowledgement of two people who had arrived at a complicated mutual understanding that neither of them wanted to dramatize. It was not a resolution that would satisfy anyone who wanted a simpler story. He hadn't been fired. He hadn't been broken. He was a man who had done serious harm and faced real professional consequences, and was still, at the end of it, a surgeon in a hospital. The world didn't always give you the version of the antagonist's downfall that felt proportional from the inside. What the world had given her was this: her license intact, her record corrected, her name off a finding that should never have had her name on it. The department she worked in had different leadership now. The residents who trained there had a different model for what speaking up looked like, and what it cost and what it was worth. Bev, the charge nurse, had told Mara in March that 2 residents had cited her specifically in their annual evaluations when asked to describe an instance of clinical courage they'd witnessed. She hadn't asked Mara's permission to tell her that. She'd just told her in the matter-of-fact way she did everything because she thought Mara should know. Mara had sat with that for a while. In April, she went back to the site of the Ford operating base. Not to the country. The logistics of that were not available to her outside of active service, but to the record of it, which Okafor had helped her access through the cleared documentation in the federal file. Photographs, operational reports, the specific geography of the place and the day. She sat in her apartment on Carver Street, which had books on the shelves now, and the photograph on the wall and a plant on the kitchen windowsill that she'd bought on impulse and managed not to kill, and she went through the record for 3 hours. She wasn't punishing herself. She was finishing something. The operational record of that day, read now with the complete picture, the engineering emails, the testing documents, the waiver chain, resolved a question she'd been carrying without knowing she was carrying it: whether she could have done something different that would have changed the outcome. The answer, with all the evidence in, was no. The vehicles had been fielded with a structural failure. The explosion had been determined by that failure, and not by any action or inaction of the medic on site. The 3 soldiers had died because a component that failed at 73% of specified load was fielded under conditions that took it to 90, and the 90 seconds she'd had to reach the 3rd soldier were not enough, and no version of her training or her preparation or her response could have changed the arithmetic of that. She had known this. She'd been told it by Ferris, by Moran, by the formal review, by the federal record. But knowing something told to you and knowing something you've walked through yourself were different, and she'd needed to walk through it. She closed the folder. She said 3 names quietly, not to anyone, just to the air in the room, the way she'd been saying them for 3 years, but differently this time. Not as an accounting of what she owed, just as names, the names of people who had existed and mattered and deserved to be spoken. Then she made dinner and called Ferris, who had been in Dunmore through the trial and was now navigating the question of what his next posting looked like, which was a question that had acquired more variables than it had previously contained, and they talked for an hour about things that were both practical and not. And she found herself laughing at something he said about a navigation error in New Mexico that had added 7 miles to his otherwise well-planned hiking route. And the laughter was real, which was its own kind of information about where she was. The Field Trauma Assessment Manual took 8 months to complete. She wrote it in the early mornings before hospital shifts and during the stretches of travel for the consulting engagement. Hotel rooms in Fort Bragg and Coronado, and an air base in Nevada that she wasn't supposed to mention by name. Sitting with her laptop and the specific stillness of early morning and the work of translating what she knew into language that other people could use. It was the most difficult professional thing she'd done since leaving the Army. Not because the content was hard, she knew the content, but because writing it required her to go back repeatedly to the specific experiences that had formed the knowledge, and some of those experiences were not ones she'd previously been willing to revisit at length. She revised it 4 times. General Marine's team reviewed it. Robert Garza, who had been hired as a technical consultant to the IG's post-trial review of Army procurement protocols, read an early draft and sent her 2 pages of handwritten notes that were detailed and specific and showed a structural engineer's understanding of failure mechanics that improved 2 sections considerably. She incorporated his notes. She thanked him. He wrote back that he was glad to be useful, which was a sentence that carried more weight than its 7 words. The manual was distributed to Special Operations Medical Support Units in the following fiscal year. She did not attend the rollout briefing. She was in the middle of a training engagement in a different location. But Morin sent her a photograph of the first training session, 50-odd faces in a classroom with her document on the table in front of them, and she looked at the photograph for a long time. She did not think, this makes up for it. She had stopped thinking in those terms. The math of what had been lost didn't add up to anything that could be called compensation, and she'd come to believe that chasing compensation was part of what had kept her hiding for 3 years. The idea that if she found the right resolution, the right outcome, the scale would balance, and she could stop. The scale didn't balance. That wasn't what happened. What happened was that you kept going, and you used what you knew, and you showed up in rooms where the outcome mattered, and you said what you saw even when the person with the most authority in the room told you to be quiet. You did that not because the arithmetic worked out, but because the alternative was silence. And she had tried silence, and it had not protected her or anyone else from anything. That was the lesson, if there was one. It wasn't elegant, it didn't fit on a poster, but it was the thing she'd actually learned in a trauma bay at 10 at night, with a man dying and a doctor who was wrong and herself standing in the corner deciding whether to say something. She had said something. She would keep saying things. On a Thursday afternoon in October, 8 months after the nursing board hearing, Mara was in the trauma bay at Harrowfield when a code came in. Cardiac, male, 58, came in conscious and crashed in the elevator. She was the senior clinical presence in the room until the attending arrived, and she worked the code with 2 residents and a nurse she'd trained herself, and they got him back in 4 minutes and 30 seconds, which was not fast by any abstract standard, but was fast enough for that particular man on that particular Thursday. And afterward, one of the residents, a second year named Priya, who had the specific quality of someone who was going to be very good at this job, looked at Mara with an expression that was tired and wired and lit up in the specific way of a person who has just done the thing they came here to do. "How did you know to do the precordial thump before the second shock?" Priya asked. "That's not in the standard sequence." "It's in a field protocol for resource-limited environments," Mara said. "The electrical stability can be different after blunt cardiac contusion. He had bruising on the sternum consistent with a steering wheel impact." Priya processed that. "Where did you learn that?" Mara looked at her. At the young resident with the lit-up expression and the question, which was a good question, which was the kind of question she'd been asking rooms for years, and which rooms had mostly declined to answer. "Somewhere that doesn't exist officially," she said. "I'll write it up for you." Priya nodded. Then she looked at the patient, stable now on the monitor, and back at Mara. "Thank you," she said. Not performance, just the direct gratitude of someone who understood what had just been given to them. Mara nodded. She finished her documentation. She clocked out at 7 and drove home through the October dark, the city moving past her windows in the ordinary way of a city at evening, lit and inhabited and indifferent to the specific weight of any one person's particular Tuesday, carrying on regardless. She was 31 years old. She had a cleared record and a job she was good at, and a consulting role that used the parts of her that had spent 3 years being unused. And she had the ongoing complicated project of a person she was cautiously, imperfectly, building something with. She had a plant that had survived 4 months on her kitchen windowsill, which remained an unexpected source of satisfaction. She had a photograph on a wall and books on shelves and a go-bag in the closet that she hadn't unpacked because she still thought of it less as paranoia and more as professional habit, but which she'd moved from the floor to the top shelf, which was its own kind of statement. She parked on Carver Street and sat in the car for a moment before going in. The parking lot light was working. That small thing, the ordinary functioning of an ordinary light, had acquired a particular quality for her that she found she didn't want to analyze too carefully. It just worked. The lot was lit. She could see clearly. That was enough. She got out of the car and she walked into the building, and she did not look over her shoulder, not because she'd stopped being careful, but because careful and afraid were different things, and she had finally, after a very long time, separated them. The frightened woman who had stood in a corner in oversized scrubs, calculating the cost of speaking, she understood now that woman had been brave, had always been brave. The courage had been there before the outcome confirmed it, before the federal case and the cleared record and the restored rank, and any of the external validation that made it legible to people who hadn't been in the room. She'd been brave in the corner before anyone saw it, and she'd been right, and she'd kept going. That was the whole story. The rest, the case, the verdict, the manual, the consulting role, the photograph on the wall, was what happened when someone who was already brave finally stopped apologizing for it. She unlocked her door and went inside.